The next witness, Tabang Shokwe. The witness name is not on the list. My Lord, this witness is going to testify in respect of exhibit VV in bracket 1. We have, the exhibit has already been handed up, but we hand up a complete copy that consists of 4 pages. Okay. We have marked them accordingly from page 4. I've also given my colleagues a complete copy of the report.
Okay, thanks. You have the all councils.
That's correct.
Okay, thanks. Okay. Yeah, can you say the witness English?
English.
Okay, your full name, please.
Full name is Tabanko.
Yes. Do you have no objection in taking the oath? Consider the oath to be binding and conscious.
Yes.
You then swear that the evidence that you're about to give will be the truth, the whole truth, nothing else but the truth. If you say so, raise your right hand and say so, let me go.
I
The witness is sworn.
What is your question?
My occupation, I'm a dentist. Usually the qualification they call it the BDS. In full intention of it is the Bachelor of Dental Surgery. I completed my qualification in SMU, which is called Spagomahat, but before it was called Medunza. So
amazinyo lokubiza lelo ukuthi i-dentist ngaphuthula-ke iy'fundo ze-BDS bayibiza ngokuthi i-Bachelor of Dental Surgery ukuthi-ke usebenza-ke ngamazinyo phambilini-ke manje bayibiza ifako makhatlo kodwa ngaphambilini kwakuyi-Medunza.
And when did you obtain the Bachelor of Dental?
my 2019. I studied there for 5 years.
Ngagcina-ke noma iy'fundo zami ngayiphuthula-ke ngayo ku-2019 ngafunda khona lapho-ke iminyaka ewu-5.
And Doctor, what does your experience entail?
In general, what we are taught from the beginning to be able to one function is able to examine a person from the waist up, and also looking importantly our factor and most thing that we focus on, it's the head and the oral cavity.
Thina-ke sakufundiswa-ke ukuthi-ke umuntu-ke masimbheka-ke simqale-ke ezathi ukukhuphuka naye-ke sigxila-ke futhi-ke kwikhanda-ke kanye futhi-ke nakuwona-ke ngaphakathi emlonyeni kumazinyo.
Now, Doctor, to examine a person from the waist up, can you be more specific?
Being more specific, we look at the general appraisal. If the patient from the waist, if there is the patient shows any sort of disabilities, any sort of defect, if the patient maybe it's been hurt, the inspection point of view, not proper examination from the eye view. We fully inspect the face, whereby we would put on gloves and then look at factors. Would look at if there is any lacerations that has to do with the nose, the mouth, and also the neck.
Okay, ukuthi-ke sibheke nje sibukeke umuntu siyamxilonga kodwa-ke sibheka lokhu esikwazi ukuthi ukusuka la ngaphezulu-ke ukukhuphuka-ke ebusweni sifaka amaglavu umuntu ebusweni ukuthi unayo yini imihuzuko anayo.
And then if we check the whole waist up and we see anything that it's not within our scope, are instructed to refer to certain disciplines so they can deal with those factors.
Siqeqeshwa-ke noma sifundiswa-ke ukuthi uma umuntu simbuka simbheka-ke sibese siyabona-ke ukuthi khona-ke la engahambi kahle noma khona ukulimala khona. Uma siqeqeshwa-ke noma sifundiswa-ke ukuthi thina-ke bese kufanele manje udluliseleke mhlampe asithi-ke kudokotela ofanele okuyena-ke ozombheka.
And which disciplines would that be?
The disciplines mostly if there is severe injuries to the face, maybe we have and maybe the patient appears to have some step defect, the face doesn't look properly the way which it looks, it looks like it's a bit deformed. We send it to a maxillofacial. If it's on the, has to do with the torso and the hands, and we see or maybe there's something really wrong, we refer to, if you say in layman's term, a general practitioner, which is a doctor, and then they take over from there.
Kuya ngokuthi ke ikuphi la esibona khona ke ukuthi ke akuhambi kahle uba ubuso kula emzimbeni ke ilana ayikhala ukho ngendlela bekufanele ukuthi bese siyamdlulisela ke osebenza ngakona lokho.
Can you put your work experience on record?
I did my ComServe from 20 until 2020 in a community district. That was ComServe. And then from 2021 and onwards until present, I have been in private practice, which entitles that I have my own establishments that I run, and then I practice as a dentist.
Umsebenzi wami ke ngo2021 sorry ngo2020 2021 ngisebenzile ke la engenze khona ke abakubiza ngokuthi ke iComServe ukusuka ngaye ke u2021 kuze kube manje ke ngiyisebenzela ke mina ke kodwa ke ngiyisebenzela nginjalo kodwa ke ngesikhathi ke la engihamba ngiyosebenza khona ngale futhi.
That might be common parlance in the medical fraternity, but in what is ComServe?
In layman terms, we in our medical study within after 2 years, we're already starting to do our clinicals. It's real normal setting where we see them under supervisions of our superiors, and after those years, after the we have to serve the state every.
Okwenzekayo ke noma uma ngichaza ke lokho ukuthi ke inkathi sisa kuminyaka esinikezwa khona ke ithuba lokuthi ke manje aboneke ama patients kodwa asisekho ngaphezulu kuthini noma abasiphethe ekuyibona ke ababheka ke noma mabuka umsebenzi wethu esiwenzayo ke bese kuthi manje ke noma ke iminyaka emihlanu esiqedile after 5 years.
So in this community service?
Yes.
ComServe lona ke ukuthi ke siyosebenza emphakathini noma senza umsebenzi khona ke emphakathini.
And if you say you've got your own establishment, you refer to the fact that you are practice.
Ukuthi ke mangikhuluma ke ngokuthi ke manje ne practice young ukuthi ke ngiyisebenzela ngiyimele.
Show you a document which has been marked exhibit VV in brackets 1. That document?
Yes, I do. It's a form that we use in the Northwest District for examination that we dental department. Is the stuff we use as dentists. We with the patient, we have questionnaire, and then we have examination of the patient.
Lana ke noma ke le document ephambi iyona ke esisebenzisayo uma ke sihlangana ke noma sibheke ke i-patient la khona ke thina sibukela noma sibhekela lokho esikubonayo kanye futhi sixoxisana sikhulumisana nayo i-patient.
You want to turn to page 3 of exhibit VV in bracket 1. Yes. There's a place that is reserved for a signature. Signature there. Whose signature is that?
That's my signature.
Kule page esithathu ke ongibuza ngayo la ongibuza khona ukuthi senda lapha yana imina wasayina la.
Thank you. I ask you to go back to page 1. Can I ask you to read the contents of exhibit VV in the report, and if you can do so slowly, giving the interpreter a chance to interpret and explaining all the medical terminology.
So from of the we have, it starts with the stem for the health department of Northwest Province, Republic of South Africa. So it states it's Tlhabani which is Tlhabane Central Health Community. So it's services. So the form starts off by patient's name, as we were saying, it's so, and then it has the patient's age, and then we also indicate the patient's gender, that it's a male. The patient's age, it's 29 years time of the examination. Go on to allow the patient to give us the next of kin information, which is the patient stated it's Ulebogile. This was a partner, and then the cell phone numbers, and there's also an address which says it's 25 Freedom Phase 2. The patient's age, which in this it was indicated that the patient was born in 1990 in December the 2nd.
Lana ke le form lena ke uma siqala phezulu nestampu khona ke somnyango wezempilo wase Northwest iyachaza ke futhi Tlhabane CH ukuthi ke senithola manje futhi ke noma ke kohlangothi lamazinyo futhi ke ichaza phayana the patient Bongani Sandiso noma ke ngendlela ebhale ngala umntanzi eminyaka yakhe u29 ukuthi umuntu wesilisa ukuthi ke lowo ke ahlobene naye ke uLebogile Phethang oyipartner yakhe inamba yakhe nokuthi uhlala kuphi u3125 Freedom Park kanye futhi nokuthi ke ulimi lasekhaya.
And then from also ask the patient's occupation, whether the patient is employed. In this case, we got into contact with the patient. The patient was currently a prisoner, because we need to state whether it's a prisoner, it's a pensioner, it's an law-abiding citizen, those things, and then we state that. And then from there, we get to the main complaint, the main reason why the patient is in facilities.
Yeah, just a minute, Doctor. Yeah, Doctor, if I may interrupt, you mentioned that he was a prisoner. Do you perhaps independent review for this patient?
Even the where the Tlhabane district is, it's for us to encounter prisoners. So in my time, I would say for that whole year, he was the only person, only prisoner, the only person that I saw that year.
Qhubeka ke nokuthi chazeke mhlambe umuntu lona ngoba sifanele sibhale ke usebenza kuphi noma ke uhola impesheni lana ke kubhaliwe ukuthi isiboshwa usiyabuza kumshushisi ukuthi into oyikhumbulelayo leyo ukuthi ke wayisiboshwa sikuyona noma sebenzela kuyona kwangavamisileke ukuthi si iboshwa kuloya nyaka ke engangisebenza lapha yana kwakuyisona uyena kuphela noma isiboshwa sokuqala.
And Doctor, do you remember whether he came on his, whether he was escorted?
Collection, the patient was escorted. I remember seeing, I can't remember the number of the warden. There was a police cop and also a prison warden. And I remember the handcuffs on the
khona iphoyisa kanye futhi ke nasojele nabo bekhona ke futhi ke efakwe no.
And explain, Doctor, as to where the examination took place and where the people were who escorted.
Usually in any case, when we take an examination in dental room, if it's a minor, we allow the parent to get with the patient. If it's a partner, we ask the patient if they're comfortable to having their partner within the examination room. The only time that we only have with the patient, it's supposed to be me, the operator, and also my assistant, and also the admin people. For the moment we start seeing the patient, it's only going to be me and the assistant. And that's the patient. When we were given space, I would say, the wardeners and the policemen, they went outside, they kept the door a little bit open. They told us all issues that we're having quickly, because in any protocol, a state is not supposed to be left alone outside citizens.
Okwenzekayo ke lana uzo ubuthi ke lana ke ngathi ke noma kwakuphi la owawu umbhekela ukuthi ke laba ababempheleleze babe khona yini uma kuwukuthi ke umuntu oseminyaka noma ingane kuye kuvunyelweke ukuthi abe khona ngaphakathi noma ukuthi umuntu futhi uhamba naloyo ke noma ke unkosikazi noma umyeni wakhe ke acabuzweke yena ukuthi uyafuna yini noma uyamvumela yini ukuthi abe khona ke kodwa bana kuba yimina naloyo ongilekelelayo kodwa ke la kuleli yona ke okwenzeka ukuthi laba amaphoyisa nawusejele baphuma baya ngaphandle kodwa isicapha lesi ke bazivula kancane base bengitshela uma kuwukuthi ingekhona ngibalekele kusona ke isicapha ngoba ke lekile ke uma kuwukuthi umuntu uyisiboshwa phansi kombuso ashiwe eyedwa engabhekiwe.
We continue complaint.
So main complaint usually when a patient arrives, why are they there? What's the main reason why they are there? So in this situation, the cop is the one that indicated that the patient for an oral examination has to the patient per se according to our standard, the way in which we examine patient.
Lana ke masesitshelwa ke ukuthi ke lapho ke ubuliso leyo ke iphoyisa ke ukuthi ke we patient leyo ke yayinesifiso noma ifuna ke ukuthi bhekwe noma ke ihlolwe ke la emlonyeni.
So I continued further. I remember continued further asking the policeman or specific that I'm supposed to look out for so that I can rule it off or in the situation. I remember the policeman spoke about if I should check if the patient had any gold tooth inside their mouth. So that's where I started, but I treated the exam as standard. And, that's when I started with dental history of the patient. Usually ask the patient any dental work done, whether they removed a tooth, whether a false tooth inside. The patient did state that they only removed teeth down the years. He pointed out, and then from our knowledge, I was able to indicate tooth that were removed there. So in 3 removed and 2 were in the 3rd quadrant, and
it just
lana okwenzeka ke ukuthi ke iphoyisa ke lasichazela ke ngabuza ukuthi yini kahle lena ekufanele ngiyenze noma ekufanele ibhekeke sho ke ukuthi ke kukhona ke izinyo abafanele ukuthi kwakuyizinyo ke legolide ngase ngikhuluma futhi ngibuza ukuthi ngaphambilini usuke wawakhipha yini ushilo ukuthi akhona ke amathathu aseke wawakhipha yila nginako khona ke ukuthi ngisho ke ukuthi inhlobo yamazinyo eseke ngaphambilini.
Doctor, can you explain the quadrant?
To the sides in which the teeth are located. In general, in which we chart and then we label the teeth. Label them in, but the number part in 4 quadrants. We have the which we call the first quadrant, whereby we start by it's labeled as its number. The quadrant is divided with the middle of the head to 2, and then we divide 4 the mandibular jaw and the upper jaw. So we divide it to 4. So we do it in a C format from the point of an individual. So we'd say we start on the first quadrant. It's supposed to be the first quadrant will be on the right. We go on the left as we go down, and then we go to the 4th quadrant.
Lana ke ila ahlukaniswa khona ke mase quadrant ke oqala eyesibili eyesithathu noma eyesine uzothi ke eyoqala ke ukuhlangothla ngokwesokudla bese siya ke ngokwesokunxele siyehla ke siyenzansi bese siya ke kulo lwesineke noma ke 4th quadrant yona ke ezophinda izobe ngesezansi uhlangothi la indlela leyo esihamba ngayo noma esenza ngayo uma sesibheka ke amazinyo lawo.
You explained that there was extraction in the 3rd quadrant. Can you mention the numbers?
The were done in the 3rd quadrant. It was the 3-7 and the 3-5. And we have extractions on the 4th quadrant. 4.
Okay. Can you explain the 37 and the 35?
And it's in the fourth quadrant, meaning it's the teeth that are sitting at the back partially, which we have at the molars. So in different, what we're saying, the patient had a molar and a premolar that was done in the third quadrant.
Lana ke esichaza noma esikushoyo ukuthi lamazinyo ke ayekhishiwe lamazinyo la engasemuva ke emlonyeni womuntu.
And then also on the fourth quadrant, there was one which is a 4-4, which is also a premolar that was removed, which is on the fourth quadrant, which is on the right lower.
Kanye futhi ke nelilodwa ke kuhlangothi langa kwesokudla la ngezansi elalikhishiwe.
Just in simple terms, you know, what is a molar and molar?
Food into your mouth if you're gonna chew some with the front teeth. The ones that we call them molars because usually in a way they mold the teeth. They have a larger surface area compared to the incisors. The premolar medium surface compared. It has a medium surface compared to the molars and also the incisors. The middle teeth, from counting them from number 1 until the 8th tooth.
Which are the middle ones? The molars?
The middle ones.
Okay. Lana ke la athi akhishwa ke uma ewachaza ke athi ama molars la angase wona bese kuthi kunalamazinyo ke ala ngaphambilini ke uma umuntu mhlambe ke esimala noma eseka ke ekuwona owabonayo obiza ke bona kodokotela noma incisor nala aphakathi nendawo uma bewachaza ke bachaza ngokuthi ke wona ke
Yes, may continue on.
So from the form, because that was the dental history we asked the patient, so I need to brief how we label those depending on what we already have. So when we go to the questionnaire, whereby as a general healthcare professional, any healthcare professional, whether you are a physio, whether you are a radiologist, whether you are a dentist, whether you are just a normal doctor, even a nurse, when they examine a patient, they need to ask certain questions to find out by the disease status of the patient if it's going to implement in any sort of treatment that we're going to have.
Kunemibuzo ke ekufanele ukuthi noma uyiphi inhlobo kadokotela noma usebenza ngani ke noma kunemibuzo ukuthi uyibuzeke ngaphambilini kokuthi ungaqala usebenze patient.
It's correct. It's basically the history of the patient.
From the patient's point of view, them giving us their history.
Mlando ke lo esithola kuyena ke lo muntu ozobona ke udokotela ngokuthi kube uyena ositshelayo ngaye.
Yes.
So the questionnaire goes it's a number of diseases. These diseases are the ones that are true. They are the diseases that we usually use as a standard to check whether it's going to interfere in any sort of the material that we're going to use. If there is any material that's the patient has when we study initially, we check the allergies. So we check if the patient has any allergies. They state whether yes or no. If they have allergies, laid it down if there's there. In this case, the patient didn't have any allergies as stated by them.
Ngokuqala ke ukuya ngokuthi ke yini ke ezoyise ke uma sesebenza ukuthi ke kulezo esizoyise yini ezingamphathi kahle noma la athola khona ke ama allergy esithi siqale ngakhona uzoqala khona ke nangokusho kwakhe ukuthi the answer impendulo kwaba ucha ayikho.
Yes. And then we go on to the heart disease. Then we want to find out whether the patient has any, which means or any chronic disease that's related to the cardiac, which is it's a heart disease. So in this case, the patient said yes, and then further on to ask what do they mean they have a heart disease. They spoke that back in 2014 they had a minor whereby or they have some minor disease that they stated to us, and the patient couldn't elaborate further on that, and they said they're not taking any medication. So we just noted it down because it's something that we need to take into consideration if we're gonna.
Landelayo ke awasitshela kona ke uma ebuzwa ukuthi khona yini ke akumhlupha ngenhliziyo wabe sephendula ke ethi yebo azike ukuthi ini uma esho kanjalo ukuthi ngo2014 khona ingozi nje encane ke emayela nayo ke inhliziyo nokusho ke futhi ukuthi ke ayikho imithi ke noma imithi ayithathanga futhi afuneke ukuthi siyachaza ukuthi yini noma kwenzekani kahle kahle.
So ask if the patient has any venereal disease which is just involved outside appearance of how their veins and their stem. So the patient said from there no. And also they also went on to ask the patient the HIV status, if they are positive or they are not. The patient said they are not aware of it, so they didn't want to conclude it, so we read it as no.
Okay. Apologies, Malot. Can you just repeat this one? The venereal?
The venereal disease, we're checking the vascular system. If problems with the vascular system, maybe veins, maybe they have vascular trauma, legs, or one of those things that they have clotting problems.
Lana ke uma bese ngimbuza ke kuloko ukuthi venereal yona ke iphathele indlela ke yokuhamba noma yokusebenza ke kwegazi noma ukuthi ke mhlambe ikhona ke lana einyaweni anenkinga nako wasephendula ke ethi cha buzile futhi ke mayela nesimo sakhe ke ngokumayelana ke noma ngokuphathelene ke nayo ke ingculaza iHIV wabe etho ke ethi yena ke cha akazi noma akanaso ke isiqiniseko ingakho ke ngibhalile lana ngabhala no.
And what doctor the thrombosis of the leg be?
Most cases is just systematic diseases, meaning or it's a disease that may be an individual due to inheritance or due to which is they're close together. In the exam, the heart and the venereal close together, because if you have a heart problem, it might lead to veins, which means it's in the veins. But those are systematic. Any individual can have due to heredity or maybe due to certain factors, overweight and those things that they're systematic.
Lana ke engikhuluma ngako mase ngikhuluma ke mhlambe ngokuphathwa inyawo ke mhlambe asithi nje igazi ke alihambi kahle ke nokuthi mhlambe ke ugula lokho owakuthola ke komunye womndeni ugula nje okudluliselwe omunye womndeni ngikhuluma nje ngento ezifana nale.
Continue, we ask if they have any lung diseases. Usually for lung disease, we just check if a patient knows if they have any problems with their lungs or or maybe they know they have TB or any other disease, which TB is tuberculosis. So the patients have that. They say they don't have that and they don't know knowledge of having that.
Bese kuthi futhi ke ugula ke okuphathelene nazo ke iphunga nokuthi ke mhlawumbe umbuzeke ukuthi mhlawumbe uyazi ukuthi unayo yini iTB i-tuberculosis abesithi cha futhi ke akanalo nje ulwazi lokuthi ke lwakho khona lo.
So and also we went on to check if also another thing that any problems with the bleeding, because it affects the treatment. If the patient bleeds too much or they have a bleeding, in most cases it's we look for like hemophilia, the inability of the body, red blood cells to creating a clot. So we checked with that. They don't remember having any of bleeding problems in regards to that. Ask if they are on any medication, and as they stated, they said they were not on medication, and to their smoking as well.
Lana ke mase kuphathelene nesimo ke mayelana ke negazi ke nje inkinga nayo nokuthi kakhulu ke ngoba nalokho ke kuzoba nomthelela onako ke kumsebenzi esizowenza bese sho ke ukuthi ke cha akanakho. And then yila esesindlulele khona ke ekunokuthi kumbuzeni ke ukuthi mhlambe ingabe uya.
And then we went on to ask about rheumatic fever, which leads to infections of the heart valves, which leads to the body not functioning well. And the only heart problem they say they remember is the minor heart condition they had, and there was never stated to them what was actually the actual condition. So we said no. and then we went on to check the cosmetic disturbance, to check whether the patient is in full mindset, whether the patient looks a bit enabled mentally. Those ones we usually, if they have ever been in a psychiatric hospital, those instances, if they do have admitted to any psych hospital for not being in the right state of mind due to depression or any of that, the patient said no.
Lana ke uma sesiphuma ngayo ke rheumatic fever ke ukubheka ke isimo sezomzimba wakho ukuthi ke indlela ke umuntu azizwa ngayo nokuthi khona yini ke ngaphathi kahle lapho abesephendula ke ethi cha. Kubhekwa nasibheka futhi ke nesimo ke mhlambe akukho yini ukuphazamiseka okukhona ukuthi mhlambe umuntu lona wayeke waya yini kwisibhedlela ekubhekwa khona ke abantu akukho yini ukuphazamiseka kula ngengqondo nalapho impendulo yathi cha.
We want to know, generally we ask, it's here in the questionnaire whether the patient is pregnant. As a man, obviously we take no. A man can be pregnant, and then we also have infections. In regards to the viral infection, we look at viral diseases. We're talking about herpes simplex, which is in normal things like chicken. The viral diseases, a range of them. So we explain to the patient what kind of viral diseases there are. They don't have any viral disease that they could remember of.
Olandelayo ke ukubuka ke ukuthi ke uyithwele yini ke umuntu wesilisa ayithwaleke ila esesibhala khona ke sithi kubuzwa ke olandelayo ke ama infections ke la chaza khona chicken pox obe esephendula ke cha.
And then we all went on to check, ask the patient if they have any epilepsy. Epilepsy, most people in common terms, the patient tend to get into randomly due to triggers, maybe flashing lights and other things. So the patient said they don't remember having any sort of. So, and then we also went to ask if they have, which is in common layman's terms, it's called the sugar diabetes. So, which is they have any problems with the glucose level. In regards to that, the patient, they said no. And then we also have the problem. We explained to the patient what kidney problems is. The patient said they don't remember. And also blood as well. And the patient said they don't have any high blood and they are not taking any high blood medication.
Bese kulandelayo ke ukubheka ke manje ke lokubizwa ngokuthi ke amafrithi ke ukuthi unawo yini ethi cha ushukela noma isifo ushukela phendula wathi cha inkinga ngeinto zakhe noma ke ama kidney akhe nalapho phendula wathi cha high blood washo ke ukuthi nayo ke akanayo.
And then we go on to ask if the patient has ulcers. Ulcers, it's common in people. They would say in common terms it could be a stomach ulcer, it could be the ulcer that's there on the trachea system, or the ulcers could be inside both, which could be triggered by certain factors. Some people will complain maybe tomato, some would say maybe when they eat spicy things and whatsoever. So we checked in regards to that because it also impacts the type of medication we're supposed to prescribe for the patient if they have any sort of pain or infection. So we checked that and the patient said they don't remember sort of that.
Base sidlulela ke kuma asa ila lokho khona ke umunye ke uzothi uma ngidle utamatisi ke umunye athi uma ngidle ukudla okushisayo ke siyabheka ngoba kufanele sazi ke ukuthi ke medication umuntu simnikeze yona ke waphendula akada inkinga yalokho.
Further investigate if the patient has any other disease. The patient say to us if they do have, and if they say they are, in this case that we didn't back no because the patient said they are not sure if other disease. So they that we didn't mark no, and also the patient has on any sort of operation. Could be leg, could be head, could be stomach, any sort of operation the patient. And we asked them if they're taking additional drugs. We're talking about alcohol, could be cocaine, could be heroin, any sort of drug or even now, but the patient said they don't.
Buza ke umbheka ukuthi ke mhlambe khona yini ama operations eseke wanawo ke washo ke wathi mhlambe ke idakamizwa icocaine noma yini ke nalo ke
And then we went on to check. One of the random checks that we do, it's when last was the patient in hospital, because it's quite very important. In most cases, when patients come in, they tell you, I've been to the hospital 5 times, and we ask them, what's the issue in the past 5 years? What's the issue? They say they don't know. So we need to check whether they've been to the hospital, so that if the patient has been to the hospital and they're really not sure of what's really happened with their state, their disease, or whatever they have, shouldn't proceed with certain things without making that sure. So we ask if they've been to any, they've been hospitalized in the past 5 years. They said they've never been, especially they have never been there.
Ke nokuthi ke kule minyaka ke emihlanu endluleke suke waya yini esibhedlela ke la ukuthi mhlambe khona ke ulaliswe khona ke ngoba sifanele sazi uma kuukuthi ke ngempela kunjalo ukuthi ke yini ke ekuhluphayo ngoba sikwazi ukuthi sonke umsebenzi singazi ukuthi uthwa yini ushilo ukuthi cha buzile ukuthi usuke waya wabonana yini ne specialist kuminyaka emihlanu endlule nalapho aphendula khona athi cha.
And then there is a medic alert member. Medic alert individuals that are within a community whereby they need to have either or a brace to show that they have any sort of condition that needs to be paid attention to. It could be whether the patient is medically retarded, or the patient tends to be schizophrenic, in order for us to be able to identify that if the patient maybe gets into their medic need, we don't know what's happened with the patient. We ask them if they have any sort of those markings, so we're supposed to know about them, and they said no. And also checked if the patient has asthma as well, and the patient said no.
Okulandelayo ke ukubuza ke nokwazi lokhu ke ngendlela ekubhalwe ngayo lana ke i-medic alert member ilana ke nabantu ke ozokuthi ke kumphakathi abantu mhlambe omunye ke une brace anayo ke noma efakiwe ke la esandleni, omunye ke une necklace ayifakile echaza yakho noma eshoyo ke ukuthi lo muntu loyo ke kukhona okumyo shiloko wathi cha, sambuza ke ngesifubani noma ke ask for washo wathi cha akanayo.
Already with the further the details that we actually, when a patient has to any form of information that we ask on the questionnaire, we state it down. I've already stated what the patient said, yes, they have had a heart problem, and then they have reported to be admitted of a heart condition following a mining accident, which was kind of really minor. Then we go to the vitals as well.
Bese kuthi ke manje ke eminye ke imininingwane ke bese ngishilo ke ngaphezulu ke ukuthi ke washo ukuthi kwanele inkinga ke inhliziyo ke eyenzeka ke mining, kodwa ke kwakuyinto etholakala ukuthi ke incane.
And what are vital signs?
Vital signs, usually we check the general stuff. In this case, because of us, we look at specific general notion, which is we check the blood pressure of the patient, and also the pulse, which is checked by the medical people who just to find out how the blood pressure of the patient is. And in layman terms, the blood pressure, it's an indication of how the blood system of a particular patient is working, which is the if the high blood it's high, and roughly in most cases it's over 120. It's over 100 over 120. We say the blood pressure is within the high of the patient. In this patient we checked, the blood pressure was within the range of the expected range of it being high. So it says the blood pressure was normal for an individual. When we're saying high, the blood pressure, it could be in an instant the patient has been maybe in immediately activity whereby maybe they were another one could be a patient if maybe they were involved in a fight. The heart on its own will blood pressure to supply the body with a significant amount of blood, so the blood pressure will be high. It's one of the normal cases the individual will have. The other indication of a high blood pressure, the cardiovascular is within stress, which leads to patients that we say they have high blood pressure which is uncontrollable, which in most cases to systematic activities let's say maybe the patient is maybe overweight, or maybe they just actually in general their cardiovascular system is suppressed for somehow it's not well. Say the patient has a high blood pressure and they'll put them on treatment to regulate that high blood pressure. So in state of traumas, patient, yes, maybe through an altercation with someone they are fighting, the blood pressure immediately, within, we say maybe within an hour, it might be high, but in that case, it's supposed to turn down and go down within a couple of hours or so, depending on how severe the trauma was. If the trauma was severe, wake up, go high, and then drop significantly. When it drops significantly, automatically it's either it's even in one of these, the body is in distress and the body is losing a lot of blood, meaning pressure towards the body system, the blood level it's reducing and the supply is going.
Uma sasibheka ke ukushaya ke noma ke unamlinganiselo ke okhona ke la esingathi ke phakathi kwakhe usithi ke liphakeme kakhulu uma phakathi kwa100 kanye naye ke u120 kodwa ke uma sibhala sasho ke ukuthi ke lingaphansi la ekufanele ukuthi libe khona ke ngoba ke iningi ke izinto ke noma engabangela ukuthi ke igazi ke noma ke ibe phezulu, asithi ke mhlambe umuntu ebegijima, mhlambe umuntu ke bekukhona ke kunqubuza noma ke ukuba okuthatha ke isikhathi kungayihora kungamahora ukuthi likhuphuke bese liyaphinda futhi liyehla liza phansi. Iyona ke esitshelayo ke ukuthi ke ipressure yomuntu futhi ke yini ke engaba imbangela yakho khona lokho.
Yes. And then the patient,
so the bottom value, you talked about the top value, the 117 and the 78. What does it represent?
The 117 means it's within, we have systolic and diastolic, and then the 117, they go both. We look at the systolic, and then when it comes to both of them, the one that says 117, if it's 120, it's the one that mostly we are concerned with. It's that one the patient has a regular and normal high. Just above 120, it's when we start looking at, or maybe the patient might be maybe a bit stressed, that's why the blood pressure is up. But once it starts the thing, we start getting concerned with the has high blood pressure, meaning what is the diagnosis of saying what they had a high blood pressure. As it goes further on into 150, the severity of it, whether control, whether it's under, it's not in control.
Uma sesibheka ke lana kuyena ke u120 ila sithi ke ila kodwa mase likhuphula ke liya ko120 bese sibheka ukuthi mhlambe ke umuntu ke mhlambe unestress ke likhuphuka liye ko150 ke umuntu ke unayo ke i-high blood pressure.
In that value 117, is it the systolic or the diastolic?
That's the systolic.
And the systolic is?
It's this 117.
And it is? It means?
It means it's normal.
Okay. 117 ngoba lana ke kubhalwe u117 ukuthi ke eli normal lelo ke noma ke ekuyilona.
That value at the bottom, the 78?
Diastolic also we just look within the range of 90. If it's above 90, that's when we also have concern. But the most important one, it's the one of 1. Is the one that indicates or it's the one that we look after. If the maybe slightly a bit high, if it's not the diastolic and the systemic normal, we kind of can rule it off as normal or within the range of saying what we can say it's normal.
Lana 17/78 ke sinala khona ke siyambheka ke u78 uma kuukuthi ke u90 yakhuphuka ke uya ku90 ila esesiqala khona ke sibe nako ke ukhathazeka kodwa ekuyona ke esibheka kakhulu ile 20 nokukhuphuka ke iye phezulu sibheke ukuthi normal noma cha.
But in short, doctor, you said the blood pressure of 117/78 is within the normal range.
Yes.
Ke kafushane nje na uma ke njengoba lana kubhalwe 178 ileyo ke le ngathi ke ekuyona noma ke
Yes, may continue. The next one.
And then there's also the pulse, which is connected with the blood. And then the pulse, we're just checking the rate. It could be, it's within. We check whether if how quickly the blood it's been passed through the cardiovascular system. Usually, most people could see in movies the person has passed out and they're losing blood. Put a finger around the jugular area to check whether the pulse it's still there or not. So within this, it's a normal range. So if it drops, let's say 60, the patient is really having the cardiovascular system is failing. So a lot of blood, or the heart it's giving up on pumping blood.
Bese kuthi ke ukubizwa ke ngokuthi yona uzobuka ke uma ubuka ke ama movie isikhathi esiningi ke uzothola abantu umuntu ebeka ke bebeka iminwe yabo khona lapha ubheka ke ukushaya ke noma futhi ke ukuhamba kwegazi ukuthi kwenzeka kanjani ke uma kungaphansi ke kwakhe u60 ila esesiqala khona ke manje ukuthi ke sibe sesi kuyasikhathaza ke ukuthi ke ingabe isimo sithini.
Can you just put that pulse rate on record? What was the pulse rate?
The pulse rate 2, so within normal range.
Lana ke kwaku 72 ke esingathi ke iloko ke okuvumelekile nokwamukelekile.
Yes, may continue with the form.
And then from there, the patient had a signature whereby they had a spot where they can sign to saying whatever they've given us the is correct from their own side, and they did sign. And the date on which signed, it was it was June 20.
Khona nendawo ke la khona ke esisayinda khona ke lo ozobona ke udokotela patient ke ukusho ukuthi ke ngaphezulu ke noma lokho asitshele kona kuyilona iqiniso ilanga ke okwenzeka ngalo lokho noma ke asayinda ngalo kwakuyi 22 20.
The time, Dr. Kenny, more or less.
The time is stated in page 3.
Isikhathi sibhaliwe ke ku page 3,
which is, if you can see due to the copy effect, it says it's 12:52 when the patient was seen.
Patient yabona ngaso kwaku 2
when they entered to be examined, because this is the one that took place for when they were doing the vitals, which are the blood pressure and the pulse as well. That's when the time that they were seen.
Okay, abona ngaso kuma kwenziwa konke lokuyana ukubhekwa ke ukuthi ke sikanjani.
So may proceed to page 2.
So in page 2, it's the clinical examination whereby the patient from the extraoral perspective, meaning where it's where we start checking the patient generally speaking and getting details. So in what we do, we are supposed to check the extraoral examination. We check the general appraisal, which is look at the patient and we look at how whether they're normal or the patient looks to have any maybe sort of disabilities or any sort of defect that to a normal medical healthcare professional terms, given the anatomy that we learned and the conditions that we were given, do they look do the general appraisal look normal to a normal looking person? In this case, which is I mean, when we look at the patient has no abnormalities. Maybe there is I would say maybe an arm disability, or maybe the patient some sort of maybe showing, or maybe they are wearing an anklet brace to show that maybe they head or anything. The just patient look normal to not be any sort of disability. And then we check also the neck area if there is any sort of bruises. Those ones we check in general of saying what if maybe if it's a patient, maybe when we look at them they have bruises and also the face, it means, or maybe it's an when we refer to certain disciplines to be seen by a medical officer, then they can take it further and see whether what's really happening from there. So with this patient, there were not really any sort of abnormalities when it comes to the patient being bruised, disabled. The patient really looked pretty much normal at the state of being examined.
Ukuthi nje i-patient lena akukho yini la ekubhekeka khona-ke noma ekubonakala khona-ke ukuthi mhlampe umuntu lona-ke okhubazekileke uma mhlampe asithi nje une-necklace anayo noma-ke enyaweni noma nayo khona laphayana eshoyo noma echazayo nje ongahana-ke kodwa-ke kule noma mhlampe asithi umuntu lona ukuthi mhlampe ulimele fanele khona-ke andluliselwe dokotela-ke okuzoba uyena-ke osebenza ngalokho ozombheka kodwa-ke kulena-ke i-patient kwabonakala nje ukuthi cha kahle konke kwakukahle.
We went to check the TMJ. It's the joint. The joint whereby the jaw joins itself to the skull. It's in layman say it's the skull. So we call it the mandibular joint. It's sitting right to the end of the ear, right over here. But we usually, in most trauma case, patients have been hit, or maybe the patients have been involved in a car accident. Like there will be maybe some deviation, clicking sounds when the mouth. When the patient opens the mouth shifts to the left or shifts to the right. So we look at things, or whether it's a systematic fact that the patient's TMJ is not strong enough, the joint just deviates from birth. So we check those things to just know, because since we require the patient, if the patient has any defects, it becomes dislocated. We need to know, was our own doing, patient came with issues before. So that's what the cerebromandibular joints are assessed for.
Bese sibheka-ke nokubizwa ngokuthi-ke ama-TMJ wona-ke ama-joint-ke uma iwachaza-ke la kulo hlangothi noma-ke ngesenzansi nje kancane kwendlebe-ke lokho kungabangelwa-ke mhlampe ukuthi umuntu wayeke wasengozini yemoto, mhlampe uma ngabe ekhuluma-ke kunendlela ethize-ke amazwi aphuma ngayo noma ngayo fanele futhi sibheke nokuthi-ke uma lokho kukhona ukuthi lokho kwenzeke nkathi ela kuthina noma indlela afike engayo leyo.
So
ekhuluma uyabheka ukuthi mhlambe ngesinye isikhathi uma ekhuluma umlomo wakhe ushiftela ngaku left noma
yebo. We checked that as well, and then also we went to lymph nodes.
Yes, just before you proceed, doctor, what was the clinical finding regarding the TM joints?
They're normal. They look normal. The patient didn't look like they had any disability or anything that's off. That's why we tick in regards to that.
Ilapho-ke uma ubona lana kule form kuthiki imali ukuthi-ke kungokwenjwayelo lekileke ngoba-ke uma simbheka nimbuka-ke ngibona abonakala ukuthi akukho nje okungekho kahle noma ungekho.
And the most also the one that we also check, it's one of the most important one, the lymph nodes. Lymphatic system, it has a number of functions. It's maintaining the body. Usually what really happens is with the lymphatic system also maintaining fluids, meaning or if there is any infective fluids that's within the body, maybe the patient has an infection, had any fluid irregularities threatening the immune system. It's the line of defense for the immune system. So if they're having those issues, particularly when we check them, we palpate them to whether if they are swelling or they are palpable. So most of the time when they become swollen and they are a bit palpable, that's when we say maybe the patient has an infection. So in regards to us, we check the lymph nodes of the neck. Submandibular. Submandibular is just below the mandibular, between the and also the mandibular, which is the lower jaw. Palpate there to check whether they are abnormal or they are normal.
Lana-ke ukubheka-ke fluids-ke emzimbeni futhi-ke lokho kwenzeka-ke kulo hlangothi la lentamo-ke nokubheka futhi akukho yini noma okutholakalayo khona lapho.
Doctor, just explain.
Palpate, we wear gloves. We go around the area where the lymph nodes are. We on them to hear whether there is hard surface that's there. If it's hard, patient could be having a systematic, the lymph node failing. In most cases, minimal rates, they usually, like stating in cancer patients, when they are actually really sick and then it's spreading quite quickly, you find that the lymph nodes are more swollen. But infections, they become a bit more tender, and the swallowing shows, or it's not really as severe. It's only when they have serious health issues whereby they become very much hard and swelling.
Lana ke uma senza lokho ke sithatha ke noma sigqoka ke ama gloves la kuthina ke ezandleni kabe khona la ukuzwa ke ukuthi khona yini okungekho kahle ke noma futhi ke isimo sinike lokho kuyenzeka ngenye inkathi ukuthi ukuvuvuka lokho ke kube kakhulu ke ikakhulukazi ke kuma patients ke ayo ke icancer kodwa ke lana ke uma kuphathelene nayo ke ama fluids lana ke wona ke ayathanda ukuthi kube khona ke indawo engathi iba lukhuni ke khona lapho ilokho ke esikuzwayo uma sesifaka wona ama gloves.
In this case, the patient's lymph nodes, they didn't look abnormal, they were just normal, they looked normal. We didn't find any irregularities when it comes to that.
Ke sithole lutho ke kule patient ke esingathi ke kwakungahambi kahle noma kungekho kahle.
Except for infection, is there anything else that the lymph nodes to be hard or swollen?
Yeah, in states whereby in very specific states whereby if maybe the patient was maybe in an accident, or maybe they were assaulted and maybe they get fractured, maybe they are not medically attended to, lead to domestic infections that leads to the lymph nodes being swollen, to indicate that there is an area in the body that bacteria or virus is getting in and it's infecting the body, that paid in attention. It's more of a indicator of whether the immune system it's functioning or it's failing.
Lana ke lokho kuba yona inkomba ke yokuthi ke mhlawumbe umzimba immune system ihamba kahle noma cha iyafela ke lokho kungabangelwa ke into ezahlukile ke mhlambe umuntu ke ayisengozini ke yemoto futhi ke manje akwatholakala ke ukuthi ke athole noma ke ukulashwa ke kwalo tholakala ukuthi kukhona ke lana ke mhlambe ke uma sekungena ke kube infection itholakala ngaleyo.
And then we went on to the palate of the mouth. Whenever anyone takes their tongue up.
Sorry, doctor, intraoral exam.
It's, sorry from I'm walking past through. Sorry about that. The exam, when we come to the intraoral exam, that's where we start looking at what's happening inside the mouth. Mostly with certain parts of the mouth. In their face, we have the lips and we have the buccal mucosa. So when we say the lips, we're referring to the ones that we speak with, and when we buccal mucosa, we talk about the space between the teeth and the cheeks. That fashion, when we look at the lips, we look at within the lips whether there is a fleshy red, which indicates that maybe the patient has a sort of trauma, the head was hurt, or it has blood clots to show that maybe there is any sort of trauma that happened there. Because in general, it's supposed to appear pink. In general, it's supposed to appear a relative color. And most cases you find that it's not pink due to hyperpigmentation. It's something that happens systematically. It's but not really of concern, because due to our melanin of color that other people are, they will have more pinker gums, but there is a certain type of fleshy red, and also sign of blood clots within the mucosa that indicates that there could be any sort, or also if there is ulcer, or maybe there is some cuts that happen there. Trauma could be caused by anything. It could be the patient was hurt, they heated a chair and then the lips bounced on the teeth, or if maybe, for example, maybe the patient has some ulcers that were caused by maybe they ate, or maybe they have some disease, like maybe they have herpes or the beginning of an oral cancer. So those will be the irregularities. But when we don't see those things, or fleshy red, or seeing any, we see a of indicates of maybe there's a bit of blood clot within the mucosa, we rule it as normal here.
Ke uma phakathi ke emlonyeni womuntu ukuthi mhlambe khona yini ongathi mhlambe uthola ke kubomvu ke ngaphakathi emlonyeni okungabangelwa ke izinto eziningi ukuthi mhlambe umuntu leke khona la anqubuzeke khona ke mhlambe asithi nje esitulweni sekuthi ama lips akhe ke ashaya ngaphakathi ke ngoba ke ngokwenjwayelo ukuthi umuntu ufanele ubheka ngaphakathi uboneke umbala opink, kodwa akusiyena ke wonke umuntu la upink ngoba izimo ke abakhule nazo noma ke abazalwe noma abadalwe benazo ke kungenzeka kungatholi ke loyo pink loyo. Lokho ke okungabangela ukuthi ube uyabona ke manje loba bomvuko obungaphakathi ibona ke mhlambi obungabangela ke ukuthi umuntu abe nama-ulcer. Yikona ke esikubhekayo uma sisibheka ngaphakathi ukuthi nje konke kukahle kungendlela yini ngaphakathi umuntu.
And another thing that's also there that we check is the oral pharynxes and the tonsils, which they are situated at the mouth. It's they're saying it's the end of where the oral cavity ends, and then it's where the trachea, in layman's terms we call it the throat, begins. So the reason why we check these two is related to sort of infections. If maybe they have tonsillitis, you find out their throat is due to maybe a viral infection that could be in the system, especially in the or in the upper respiratory system. So, meaning also the oral pharynxes, maybe some of them, they could be maybe appears if they are blocked. Those ones we look at for it. So the patients that have shock whereby they're allergic to something, and then they might end up being adrenaline to relieve that allergic shock. So we check for that. We allow the patient to open their mouth, and then we tell them to depress down, and then we use the mouth and then we look exploring at the back to check if whatever is inside the mouth or whatever the face, is it affecting the tonsils, also the lymphatic system, because the lymph nodes that are regular and also on the neck, but the infection progressing at the back in a form of tonsillitis.
Bese ke lana ke sengicela khona ke patient ukuthi ke avuleke umlomo ke futhi ke abe ulimi lakhe ke ila esofaka khona ke isibukeke esingathi ke isipuni ke isona ke esisikhomisayo ke noma ke esikwazi ukuthi sibone ngaso ngaphakathi ke ngasemuva ke emlonyeni ila khona ke ama tonsils akala ngakhona ke ila futhi ke ekuqala khona ke umqala ke ngoba ke manje sesifuna ukuphakathi ke ukuthi ama infections nawo are khona.
Would any trauma to the and tonsils affect the way that they look like?
In instances, maybe we would say the patient, there is a trauma to the neck, and maybe the trachea it's been bruised, or there is any sort of neck. Most cases, sometimes, if it depends on the severity of it, how bad it can itself with maybe the patient a swollen trachea from the inside of the mouth, it could pronounce itself as that way. In severe cases, meaning what sometimes patients could have assaults, there could be heat, there could be done whatsoever, but there's no any sort of heats or trauma to the neck or maybe to the face that might not be sort of disabilities on that.
Manje umuntu lana ushayiweke noma ke ushayiweke lokho ke futhi ke kuzoba nomthelela ke ngoba ke manje kufanele ke sesibheka ke ukuthi ke ukuvuvuka okungathi kube khona ke engakhulukazi ke emqaleni kodwa ke uma kuukuthi ke cha ke akukho kwenzekile akashayiweke lokho ke nje ozokubona noma kuzotholakala.
So and then we move to the plate is the roof of the mouth. Everyone who lifts up their tongue and then put it on the, I usually say in to layman terms is maybe for patients who they have irritation of the nostrils, they really put their tongue on top of the roof of the mouth. So usually when we check it, we just check whether the palate is showing any sort of, let's say, ulcers. Maybe there is any lesion there, maybe let me coming from any sort of disease that's there. Maybe the patient has nasopalatal cyst that's there. Those are the things that are more disease related. So in most cases, when we check for that, we just check for the disease part of it. We don't look for any sort of trauma, or we look for any sort of condition that's associated with the basal part of the body when we check the palate. And also the size of it, whether it's deep enough, whether it's wide. Those are the things that we check.
Akunye futhi ke bese kuthi ke ipalate ke ile luke emlonyeni ke la umuntu acela khona ukuthi manje akakhuphuleke noma ke anyuse ukubheka akhona yini ama disease atholakalayo ke ngaphakathi ke ama ulcer ezotholakala ngaphakathi ke la emlonyeni uma umuntu ukhuphule ulimi lakhe walibeka la phezulu.
And then from there, we check the floor of the mouth. Usually we ask the patient to lift up their tongue into the roof of the mouth and check the floor of the mouth. So related and also systematic, because when we check the oral cavity, we want to find out that we're more interested in is the thickness of the patient's saliva, the thinness of it. So underneath the floor and underneath the tongue, which is the floor of the mouth, it's salivary. Salivary ducts are secretors of saliva. So we want to check whether it's blocked, or whether any of it, because that might affect the thickness in which the rate in which the patient secretes a lot of saliva or secretes low saliva, but also affect the patient's breath and whatsoever. But it's more of a systematic note. It has nothing to do with any other thing except for the systematic notion. We would say maybe in cases of traumas, yes, we will check maybe if the patient has severe trauma, is broken, there's dislocation of the jaw, the floor of the mouth will be affected. And that's when maybe if there was any nerve that was damaged that runs through the floor of the mouth, which is the lingual nerve, and those are the things that mostly is. Then we check for the systematical part, how it's going to affect how we're going to treat the patient for us.
Lana ke ezositshela ke noma ezositshengisa ezosebenza kanjani ke nayo ke ngokuthi ke simceleke ukuthi ke aphakamiseke ulwimi bese sibheka ke la phansi ke emlonyeni sizobheka ke ukuthi mhlambi khona yini ukubloke kokukhona ke kwawo ke amatheke kanye futhi noma ke khona ke mhlambe ukungahambi ke noma ukublokeka kwalo igazi. Ubheka nje indlela yokusebenza uma sithi ke akaphakamise sizobheka la phansi emlonyeni.
And also we check the tongue. The tongue, everyone knows, we all know the tongue, it's the one that's sitting in the middle of the mouth. So in terms of it, we're just trying to check if the tongue has any sort of radiant color. There is a certain pattern that we understand. The pattern, we're only talking about lesions only now, and then also the color, we're not really most concerned about it due to pigmentation. Some patients' tongues would have maybe browner spots, but if those are the things that we tend not to put much focus on, because in regards to the sort of lesions, if the tongue was cut, or the tongue is, or has any ulcers that's there, ulcers could indicate that the having some sort of rare cancer, or they're just having some reaction to what they eat. That's what we're checking. But in most trauma cases, if we have a trauma patient that's been whatsoever, yes, we check it to just check if maybe it's swollen. If it's swollen, we need to put a catheter to it, because it ends up in the mouth, the throat at the back, and then it affects the breathing of the patient. Besides that, we also check if there is of the tongue. We have some patients who have larger tongues, meaning when they close their mouth, they put their tongue on the floor of the mouth, it gets depressions from the jaws. We just check because it also can affect function of the patient, meaning or it could lead to the patients having some, speech problems, which could be one of the factors, but those are one of the things systematic. It's some follow-up that we look for.
Uma sibheka ulimi ke iningi izinto ayibaleke eyibhekwayo ke ukuvuvuka kwalo ke mhlambi ke kubanga ingozi ke ukushayeka noma ukushaywa ubheka kunokusikeka okukhona yini olimini ku inkathi uthola ke ukuthi abanye abantu ke siyazi ukuthi umbala olimi ngiyawazi ukuthi unjani kodwa kuthola abanye ukuthi kunama brown akhona kodwa ke akusona izinto lezo esigxila kuzona kodwa ke ukushayiseka ke okuzokutshela khona okwenzeka abanye abantu uzothola ukuthi ke nabo abanye banamakhulu ukundlula awabanye.
The clinical funding is not indicated here.
Yes, usually in most it becomes very tricky to point out, especially when it comes to the tongue. When we can't find anything that's really abnormal, we don't really mark it as normal, because in most cases the tongues are not all the same. So it's enlisted here to check whether it's normal or it's abnormal. Most cases, when we see no disability or abnormality, we just don't tick it because the normality of it's not standard. So in this case, we didn't tick it because there is no absolute standard, like I stated, for example, with the lips and the mucosa saying, most of them has to be pink. So with it, the colors vary, and we're just looking for the sizes, the ulceration. So if we're going to tick abnormal and then write the Tony there. So write whatever we found that's abnormal. But here, because we're actually saying patient's tongue and that selection, so we don't really because of that.
Na-ke kuyangabhala lutho ke ulimi ke ngoba ke ngoba sothi ke ulimi lakhe ke umuntu noma i-patient lathi ke kuloko ke okuli ngoba ke kona nezinye la uzothi khona ke yilokhu nalokhu okulindelekile noma ke khona ke ulimi ngoba ke sibheka nje ukulimala ngoba kube kunokulimala kunokusikeka ila bese siyabhala ke eceleni.
So in other words, there were no abnormalities detected.
If there were abnormalities, we were going to tick abnormal and then write the abnormalities that we actually came across.
Uma ukuthi kukhona ke kwakukhona okwatholakala kulona ke ulimi sasothika ke bese kuyabhala leyo etholakele.
Doctor, can you just place the clinical finding of the floor of the mouth?
The floor of the mouth clinical findings were the floor of the mouth was normal. It wasn't too deep, it wasn't too shallow, it was up to normal standard that we look for. There was no lesions, ulcers in that regards.
Uma sibheka ke la phansi ke emlonyeni akukho nje okwatholakala ukuthi ke mhlambe kunama ulcer kukhona nje okunga kungendlela ke yilakho ke kubhaliwe ke noma kwathikwa unormal.
Yes.
So we're going to the gingival and the periodontal. These are more invest stuff in the dental field. Which gingival, it's gum that we say it attaches to the tooth. It's in most cases it's the free part of the gum. When we examine the patient, we usually take some sort of probe in between the tooth and the gum, a very, very I would say almost needle thin standard. We put inside, it has marked the length and whether it's too deep or whether it's it's reduced from normal standard compared to the other. And then the periodontal, it's in layman terms, it's the cushion. We call it the cushion. It's the ligament that's between the bone and the tooth. The cushion that we're talking about, let's put it straight, it's like it's the cement to brick laying. So in order for the tooth to be attached to bone, there has to be a periodontum there. So if that periodontum has a disease, that means the teeth will start moving upon maybe patient chewing, or even if the patient touches it like this, and then it will start doing that. in between to stabilize the tooth. That means it's been reduced and it's been affected by bacteria, and there's some sort of infection inside there. So in regards to that, we check the and we check wherever it have any sort of infections that's there. So with this patient, the only thing that we noticed, it was that there's gingival recession. Gingival recession, we're just talking about the fact that gums relative to, they showing that the gums are not attached to the cervical part, which is the line of the crown. The tooth divided into two parts, the crown and the roots. So the cervical part of the tooth, it's where the so if it's reduced below that part, we would say it has a recession, it's gone under. So that one, it's also a systematic part. It's caused by maybe long-standing plaque that resulted into bacteria, end up eating away the gum, infecting it, resulting in eroding, and then so patient, the other factor is patient has maybe of using maybe a harder brush. We have patients who use a toothbrush for like maybe a year or two, and then the toothbrush, when it becomes hard, end up corroding, and the gum is a very sensitive part of the tissue, to a point whereby you chew a bone, you make a mistake, it hits the gum, you can end up having the bleeding of the gum. So, but if you're constantly brushing on that free part there, you're corroding it, then it ends up being resected. So it's one of those things. In this case, we found out there were 3 teeth that had that, and it was the first one on the right side, the second one on the lower right side as well, and then there was the first one on the lower left side that had that situation.
Actually saying what happens to this client here. What is Dr.
In this case, it was abnormal, just due to the maybe when we look at it, we begin by asking the patient whether they, in this case, it was
the gum.
The gums, the normal.
Lana ke esikutholile ukuthi kuningi lokushiwo amagam patient ayengekho normal.
And then from there go to angle classification. It's our part for classifying the way in which the patient bites. You know, certain relativity of a certain tooth from the upper to the down, the way in which they come, to classify whether the patient has abnormal teeth according to a certain standard that was from a survey that was made at the beginning of dentistry, to identify patients via the grouping of the way in which the teeth. So the patient is on the class 1, meaning what it's a standard classification of a normal occluding teeth.
Uma sekubhekwa ke noma ke kuclassifywa ke mhlambi ke indlela ke ongathi hlafuna ngayo ke uma kubhekwa ngokwama class uzathi indlela ejwayelekile noma ekuyiyona elindelekile uma beclassify ukuthi uclass 1.
And the only findings that were from the patient's teeth relativities is the fact that they had space in their tooth, which sometimes patients don't, due to their jaw being bigger than their teeth, so they tend to try and spread out and fill up the space. So also that one, it's a normal thing that comes with the patient with it. Some is due to maybe the patient removed, and also in this space, in this instance, the interdental spaces, meaning between the teeth that are in the first quadrant, the front one, there were spaces, but just whether some patients have it, don't have it, due to certain factors that took place, whether they were young or the heredity thing, because some families you find all of from the mother to the child, they have gaps, because that's how the family is.
Ukuthola nje ukuthi ke amazinyo lomuntu ahlangane uzothola ke ukuthi kunama space akhona ke abanye benziwa ke ukuthi ke ufuze ukuthi mhlambe ke indlela akhule engokwenzeka ke kodwa uthole nje ukuthi nje cha kunama space akhona amazinyo abanye banawo abanye.
Doctor, if I can just maybe briefly take you back to the previous clinical finding, the gingival resection, the fourth quadrant and the third quadrant, is that in any way related to oral hygiene?
It's related to oral hygiene. Could be poor oral hygiene or the patient's inability to have oral intelligence to know on how to brush their teeth, on how not to brush and when to change their toothbrush. So it's mostly related to the hygiene standard, because oral instructions comes to how patients knows how to clean their mouth, when to clean them, what to use. So it's all related.
Bekuchazwe ngaphambilini ke lokho yona ke i-gingival kuhamba ngokuthi ke umuntu ke anakekela amazinyo akhe ukwazi ukuthi kufanele awaqhubhe nini ke nokuthi futhi kufanele ukuthi ke futhi awaqhubhe kanjani nokuthi ishintshwa ngasiphi isikhathi noma emuva kwesikhathi esingakanani.
Does trauma play?
In most cases, no. Unless if maybe the only part it will play if maybe the patient had tooth fractures that to maybe the teeth wanting to be brought back in, aligned back, and maybe through the process of trying to align them back, maybe there could be a bit of gum cut, try and balance the teeth, put in whatsoever. Those patients that have been treated for trauma, not in an instant whereby the patient is kind of really traumatized.
Futhi ke nokulimala ke kuba nawo ke lapho bona ukuthi mhlambe bekhona obeke mhlambe amazinyo ke afuna ukubuyisela kwisimo sawo noma ngendlela engayo ngaphambilini noma ngaphambi kokuthi umuntu athole ukulimala.
But in this particular instance, the gingival recession, doctor said it was due to poor oral hygiene.
Oral hygiene, which showed that the patient's oral hygiene wasn't fair. I would say it's fair. It wasn't really. It was really fair because there were certain teeth that were really affected. We wouldn't really say we when it comes to the oral hygiene, we would say it's poor. Then we would say so. With the patient, it was in terms of the rating of it, fair meaning poor. It could we look at certain other parts of the teeth.
Uma ke lana uhlanganisa ke amazinyo ke ubheka ke noma ke amazinyo athize ke kanye nokunaka amazinyo noma ke singathi ke kwakumaphakathi nje nendawo ke ngoba uphuka noma ugood noma ufair phakathi nendawo ngendlela ke xubha ngayo amazinyo.
So may continue on the...
Yes, and then from there we have this charting. It's a charting that I already at the beginning when I was talking about being extracted, that we have the first quadrant, we have the third quadrant, and we have the fourth quadrant. In detail, it's the is to mark which tooth is rotten, which tooth is missing, and which tooth needs to feel is broken. So we have certain markings that we mark on the chart. If you look at the chart that we have the 1.5 and the 1.7, also the 4.8, they have zeros on top of them, and also the 2.8, the 3.8, they have zeros on top of the zeros. It's an indication of the fact that if they are zeros and they are not shaded inside a normal zero, it shows that the patient has caries, the meaning or the tooth is rotten, it has some black spot that needs to be restored. But if it's shaded, it means or the patient has had fillings, and the fillings are inside the mouth, were just whereby the patient was saw a dentist and then fillings. So, and also if there is a dash that's cancelling a certain block, it shows us those teeth upon examination, they were not there. As at the beginning, the patient said they removed teeth, so the teeth that are missing is the 4.4 and the 5 and the 3.7 in this case.
4.4 3.7 lana ke uma sibheka ke kule chart lena ke ila ebese ngichazile ngaphambilini amazinyo kuya ngokuthi ke izinyo ishiwe elibolile mhlawumbe izinyo nje elavalwa noma ke eline feeling futhi ke abhaliwe ke laphayana ke lana engathi ke kwaku where moved ne 44 u44 u35 kanye futhi naye ke u37 yilawo ke athola ukuthi kwakuyiwona aye khishi.
So those are just the markings that we do for our own purpose to know how we're going to go about the treatment.
Lokho ukusisa nje thina ke ukusitshela nje noma kube inkomba ke ukuthi sizosebenza.
And then when we go to page 3 is where we write notes, elaborating from the examinations that we have done, the questionnaire, the examination, so the chatting. It's more of a summary to brief anyone who's going to come, read the document if maybe the markings were not marked correctly, to briefly state those things or what's really happening there. And then we bring, if you check page 3, it starts by showing the date and then the operator, which is my name is stated there, Dr. Trokoti, the or program. In this case, it's progress notes or whatever was really happening with the patient in these terms.
Lana ke ku page 3 ama notes ke nje manje ukuhlanganisa lokho esekwenziwe ke ngaphambilini ukuchaza umuphi umsebenzi uqala ke kumibuzo ebuziwe ebenzo wenziwe naloyo ozobheka noma ozofunda ke futhi abesebona ukuthi yini eyenziwe.
So we are trained initially to explain how we started off the patient, which is infection that we treat. We need to practice infection, which is gloves and here I stated GM that we used to explain, or gloves and masks were worn, and then also I sterile instrument to show that the instruments examined the patient, they are sterilized, meaning they were put in an autoclave, they were to a certain temperature to remove any sort of
bese kuthi ke kuchaza ke kunama code ke esiwasebenzisayo ke uGM ukuchaza ke ukuthi ke ama mask kanye nama gloves ayifa kanye futhi ke na sebenziswa ke noma ama sebenziswa noma ukuthi ngaphambi kokuthi asetshenziswe ke nokuthi ke futhi ke asezwake.
And then I stated the full math examination was done. The report back, it's when you do a report back, you need to also state that whatever initially the patient was asking, check or looking for, whether it is confirmed, found, or it's not. So in this case, I was informed that I'm looking for a tooth that is either it shows that it was chipped or it shows that a gold was removed. So I wrote here upon examination what really happened, what I found.
Lana ke bese kuthi futhi ke ngichazeke noma ngibhaleke futhi ke umlomo ke ngawubheka ke ngawuxilonga ke uwonke kanye sekubhala ke futhi ne report back lana uchaza ke ukusho engakutshelwa yona ke i-patient engibhekela ke ngakuthola yini lokho engakutshelwa.
So in this case, I wrote that the patient shows no sign of cosmetic prosthodontic work done on them in the teeth that were prosthodontic work. We're referring to place we're talking about dental crowns, talking about gold. Those are the cosmetic, meaning or things that patient opted to have due to them looking appealing, not because they have a certain condition, unless in a crown state whereby they are forced because the tooth is broken into half. But in there were no findings regarding that, meaning there was no tooth that showed that there was a tooth the patient ever had that came at that mouth.
Lana ke nokuchaza ke nokusho ngekho impawu ke ezishoyo ke kwakunama nezinyo ke noma mhlawumbe ke izinyo lenalo nakhishwa emlonyeni wakhe.
So that I also had to do is note something that I would say maybe it's of particular concern. I realized the fact that the patient's teeth, the front we say the front top three ones. The two ones were on the second quadrant and the other one was on the first quadrant. They showed signs of demineralization on examination, showing that it's a wearing off of the enamel. It could be maybe due to lack of calcium, it could be maybe lack of a lot of acid consumption, or of the tooth structure not being strong enough to acids and other things. So it's a more of what the patient consumes and what the patient's development from a child, how it has been. Some patients decide to have demineralization, they end up having demineralization to the fact that they have maybe some maybe calcium defect whereby it led into the tooth not being developed in the certain way in which they were supposed to have.
Lana ke ukuthi ke kumazinyo amathathu ke ala angaphambili amabili ke kuhlangothi la ngasokudla elilodwa kuhlangothi la ngasokunxele ukuthi ke noma ke zokuthi abonakalisa ukuthi ke khona ke ukonakala okukhona kangelwa ke izinto ke ezahlukile ukuthi mhlambe ke uma esekhula ke noma mhlambe umuntu akuthathayo ke manje noma ke okuyikona emlonyeni wakhe okungabangela ukuthi ke kube khona lokho yabonakala engaqaphela ke kulamazinyo amathathu.
And brushing condition?
In a very rare case whereby it also brushes in order to cause that, the teeth have to not be strong enough. Because even if the only thing that a brush can actually cause tearing of the tearing of the tooth, it's whereby there's just a systematic fact. It's not an external fact whereby a person can demineralize their teeth. It's something that we would say it's some sort of need we're looking at.
Angeke ke uqubha ke noma ke ibrush kube uyona ke engakwenza ke nje ungaba nje mhlambe ke izinyo ke uma lingekho kwisimo esikahle okungabangela kona lokho kodwa hayi ukuqubha.
So in conclusion, I also signed here for this part, and then I that we use these documents, avoid or if there is any person who gets a hold of the document, they don't add any sort of information, so we indicate that this space it was not filled by the, or if somebody is going to examine the patient, whole new page of this and attach it at the back, and then that's the for the marking patients, the notes.
Bese kuthi lana ke ila engaqeda khona ke bese kuba nama lines ke akhona ke abhaliwe lapha yana ke ukuchaza ke ukuthi uma kuukuthi mhlambe umuntu ke ozofika afike ke naye ke afuna ukubhala lapha yana ukuthi ke cha kuzofanele lokho uyothatha elinye iphepha ke engabhaliwe lutho kulona ukuthi yenza umsebenzi la yena ke uqedile ingako ukuthi ala ama lines akhona lapha yana.
And then the final, the last parts of the documents includes us talking about the diagnosis. The final diagnosis from what I have diagnosed from actually viewing the patient's mouth and what is the abnormalities. So in here, the diagnosis was I wrote the patient has calculus. Calculus, it's when progress from where in a soft format it goes into a hard part whereby it sits on the gum. It's the part that end up in later in the gingival recession that I spoke to about there, because the bacteria it has grown and it's to a certain thickness, it's starting to even on the free gingiva they were talking about. So to the recession that we were talking about the other side.
Lana ngibhalileke uma sengifika ethelonike noma lokho engakuthola ke ngibhaleke la asikho lokho engaphambilini ukuthi kwakunele inkinga ke eyatholakala ke ngokuphathelene nawo ke ama gums nenkinga esendlulela ke la ku stage son ukuthola ukuthi manje ise iyakhuphukela iloko engikubhalile egcineni.
And Dr. I know you've already but can you just explain it? That
plug.
Plug, yes, plug.
Yeah, no, plug In general, in plaque, it's the development of, it's when it's long-standing and individual has been consuming any sort of products. It could be cold drink, it could be normal food or an apple, and there is oral hygiene practice, meaning the patient doesn't brush their teeth regularly, as we usually indicate, twice a day, in the morning and at night. So the food tends to remain close to the teeth, and then when they remain close to the teeth, they end up bacteria, which is found inside saliva. In general, has a normal flora. Normal flora meaning like any other coming out of the body. Most of them have a bacteria that's it's normal, but it goes over fed quantities. When I'm saying, or giving a normal example, say we have maybe a certain patient is explaining it in layman terms, diabetes, and they indicate to them, or they must stay away from salty issue to make it standard, and it doesn't go overboard, and it leads to other systematic effects. So saying that with this patient, the normal flora, because it's fed, supposed to be fed, it grows, and then it calcifies, it attaches to the tooth, and it starts in a soft format. That's when we call it plaque. But if the hygiene progressively it's poor, it can progress to calculus. So that's what plaque is.
Lana ke esichazayo ke ukuthi asiqale ke kulo la esithi khona ke ukunakekelwa ke kwamazinyo ke noma komlomo ke kungenzeki ke ngendlela ekufanele ukuthi kwenzeka ngayo. Vamise ke ukuthi ke umuntu ke akaqhubheke amazinyo kabili ngelanga noma ngosuku ke mhlawumbe ekseni futhi ke nantambama lana uthola ke ngaleyo sekuthi futhi ukudla ke noma udla ukudla ke mhlawumbe naloko kudla bese nje sekusondela ke noma kuyohlala ke kulona ke izinyo bese kuba yikona ke manje lokho okubangela ka lokho esikubiza ukuthi ke iyona ke iplaque ubese enza ke ke onoshukela la echazelwa khona ke ukuthi ukudla okuthile kufanele ungakudli ngoba ke lokho kuzoba nomthelela ke empilweni yakhe yikona ke lokho okwenzekile noma ke kuyona the patient.
And then we say the other finding is there is irreversible. I'm going to put it maybe in terms, or just simply referring to the fact that reversible pulpitis, it's when the tooth becomes inflamed bacteria, which is caries. The black stuff that we see, it's bacteria that's eating away the hard surface of. So what we're saying is it ate up the upper part of the tooth, the pulp. It's at the beginning, meaning where we can clean up those black things, fill up, and the back to a restorative function, and it might not progress, meaning what we can actually try to stop or reverse the progression of the caries, which is the rot in this case. And the number of the teeth that are they were already marked there, already mentioned 2-8, which means is the second quadrant, 1-7, which is first quadrant, 3-8, which means the fourth quadrant, 4-8, which means is of the fourth quadrant.
Esichazayo ke ukuthi ke bekuse kungabuyiselwa ke noma bekuse kungalungiseka ke ukuthi ngoba sibona ke ukuthi manje izinyo leli ke ibacteria siyaqala ke ukulidla kodwa ke ibisingakahambi kakhulu ke isengaphezulu ke kulona izinyo, so ukuthi ke bese ngathola singakwazi ke ukuthi ke sesingaklina ke manje lelo zinyo lelo bese siyaphinda futhi siyalivala ke noma ke siyalifila ukuthi libuyeleke noma lokho kumnyama esekubonakalayo lapha sikhiphe yaphinda ke izinyo ke libuyela njalo abhaliwe ke laphi ke lawo mazinyo ekwatholakala ukuthi ke anayo inkinga wabhale ngokunamba ke kodwa lawo manamba ayachaza ukuthi yiliphi izinyo u28 u17 u38 kanye no48.
And then from there also I've already indicated what interdental spaces means, or the spaces between teeth, the way in which the teeth are arranged inside the mouth. And I said the lower have mild crowding. Mild crowding, we're talking about teeth that are not really straight, they are not really aligned. The other one is forward, the other one is at the back. So we're saying it's mild when the spacing in between, it's a certain length that we usually look for, the crowding that we look for. So in this case, it was mild, it was not really severe. So we just also marked those as well as say the patient has
bese sishilo-ke noma bese ngishilo-ke ngalamazinyo-ke noma uthola kwakunama ake phakathi kwamazinyo akusuke ahlangeneke nokuthi-ke kunaleya mild crowding engayichaza ukuthi-ke uthola ukuthi elinye izinyo-ke elinye-ke ngasemuva.
So another one that we actually stated here, I said it's partial endo. Endot, the partial endot, the endot just stands for edentulous, meaning that edentulous is a term that we use for patients that are missing certain tooth or they're missing. We'd say it's partial because certain teeth are missing of the teeth. If the patient didn't have teeth at all, we'll say the patient is edentulous or they don't have. We've stated it's partial, meaning what that are not there. The patient already stated that they have removed.
Bese kwatholakala futhi-ke nokuthi-ke kwakuna ayengekho shilo-ke naye wayeshilo-ke naye ngaphambilini ukona amazinyo awakhipha.
And then we go to the treatment plan. The treatment plan is the things that we are going to offer for the patient to restore them to, let's say, the mouth being at maybe it's 80% close to 90% full functional. Things that's there, it's we say clean scaling and polishing just means just cleaning the teeth, the plug that's there so that gums won't be affected. Pinning there, also have corrections, which is what I touched on, saying or you need to brush. You need to stop using a harder brush, get a softer brush. Also already they're supposed to brush, and also telling them that there is maybe a certain tooth that you need to when you're cleaning, clean there more frequently to avoid certain plug development. That's what's happening.
Kanye futhi-ke lana-ke bese kumnikeza iplan-ke yokuthi-ke kufanele-ke awanakekele amazinyo akhe-ke ukuwapolisha-ke futhi-ke nama-instructions ukumchazela-ke ukuthi manje ukuxubha-ke kufanele kube uxubha kanjani kabili kanye futhi-ke uma kuwukuthi-ke usebenzisa ibrush elikhuni uthole manje-ke ibrush nokuthi futhi uma kukhona ithize ekufanele ukuthi ugxile kulona-ke noma-ke ulinakekele manye.
So and then we say one it's fluoride treatment. It's actually just use fluoride, which is toothpaste that we use, whether it's Colgate, whether it's Aquafresh, there is a certain inside, it's called fluoride. It strengthens the teeth. So after cleaning, after giving the patient oral hygiene, we usually apply inside a tray, and then we allow the patient to about roughly 50 to actually allow the opened gums and all teeth that were recently cleaned for the fluoride to be actually absorbed into it to protect the teeth that were actually more of developing caries to protect there.
Manje-ke lana ikhuluma-ke ngokubuyisela-ke noma kwawo-ke amazinyo kunento i-fluoride noma-ke usebenzisa i-Aquafresh, usebenzisa i-Colgate-ke na-ke ine-fluoride. Kunento-ke engathi-ke i-gel esithatha-ke sithi-ke umuntu-ke akayi noma-ke i-patient-ke ifake ngaphakathi noma-ke ifake emlonyeni ngemizuzu-ke ewu-15 alumeke.
And then we're speaking of the restorations that needs to be done. The ones that we noted that were really severe, we place make sure that the 5-7, the 1-7 and the 1-5, they're actually restored, because they were the ones that we would say the caries was moving progressively, that we need to restore in that terms. Patch those in a certain layman terms. And the other thing that we also noted, it was that the patient required orthodontic treatments interdental space. It's an option of the patient if maybe they are having between the teeth. If they want to close it, then say we recommend orthodontics, or they undergo a orthodontic treatment in any dentist that could perform to the gaps. It's more of a patient's appearance. It's nothing that's detrimental to oral function, unless if it's in a severe crowding, they are allowing the patient properly. And that's where we say orthodontic need to arrange the teeth to its back original standard functionality that we know.
Bese kuba nalamazinyo ngathi ke iwona ke bese ubuthola ke manje ukuthi iwona adleka kakhulu ke manje afuna futhi ke ukuthi ke ke hamba ke u15 kanye futhi no17 treatment kuhamba ngokuthi ke kule treatment lena ke ibizwa ngokuthi orthodontic, ukuthi ke i-patient lena ke iyamhluza yokuthi kuna akhona ke izinyo indlela nje ke yokubukeka ke kodwa ke uma kuukuthi ke akusiyona ke into emhluphayo ke angayike kulokho, kodwa uma kuyatholakala ukuthi ke kunenkinga ekhona ke amazinyweni, mhlambe umuntu athi ke angadla kahle ahlafune kahle amazinyo amile ngayila sizosho ukuthi kunenkinga kufanele ayoyenza.
And then in conclusion, this is the treatment plan page. We allow the patient to actually sign, or say patient sign. And if you check, there is a signature for parent, for in case if the patient, and also indicates the day in which it is the 22nd of June 2020. So in conclusion, these are the exams that we perform on any general patient that we whether they have any conditions they have whatsoever. It's a standard that we do in order to find the for the patient that we have, and also the treatment plan out here. So usually the file was also, it ends up being, and then it's kept in the database. Usually we always say the files are supposed to be kept there for at least more than give and take 20 years since the patient has been examined. So they are supposed to be kept in the database 20 years. It never returned to the institution. That's when most of the time they say that they do have the right to maybe somewhere in storage, but we keep them at the institution because we have the belief that patients are back for their checkups once every 6 months if they can. So this is the that we use.
Esisebenzisayo ikona lokho kwenzeka ke uma ubuka ke lapha ezansi ke ibhaliwe patient signature wase eyasign date i22 zika June nendawo echazoyo ke ukuthi isignature uma kuukuthi leyo ke umntwana ke osemncane ngokweminyaka iyagcinwa ke khona lapha ke kwi-system noma ke kwindawo lena esebenzela kuyona ke iminyaka ke ewu20 ukuthi ke umuntu akatholakala ubuye ke kuleyo minyaka leyo ke igcina ke kwi-storage, ngoba ke okufanele ukuthi ngo 6 months kufanele ukuthi umuntu abe uyabuya ke azobhekwa ukuthi ke noma abheke isimo sokuthi emuva lashiwe ke lapha yana ukuthi inqubekela phambili ikanjani.
Now, doctor, do you remember the time you concluded the examination, or more or less how long the examination took?
More Yes, the duration of dental examination, we're just talking about the examination if we're not getting into the treatment. It's a patient in standard terms. They mustn't have less than 30 minutes or a dentist. What we are looking for is specific. If the patient arrives and there's a rotten, then you go through straight to it. When you check it, it's rotten, you pack up. Okay, it needs to be removed or it needs to be done root canal. The duration could be longer or it could be of removing it. In most cases, the source of the pain, explain to the patient, and then that's the dental examination, not including the questionnaire. The questionnaire, it's a separate time. I would say we give it almost 15 to 20 minutes for doing the question, first page, getting out information from the patient. Talking about the actual exam, they start looking at the patient from the mouth, doing the palpation and whatsoever. It's supposed to be a standard of 30 minutes tops or more.
Lana ke uma kukhulunywa ngesikhathi ke akufanele ke kube ukuthi i-patient ke ichitha isikhathi esingaphansi kwayo ke i-30 minutes kanye naye ke udokotela asikakhulumi pages eqala abuza khona bese eyaphendula ke ungathi ke u15 20 minutes uma ke manje sesidabeni ila khona ke u30 minutes kuya ngokuthi ke fanele ukuthi ke yenziwe ke nalapho la kungandlula khona ke kuleyo 30 minutes loyo.
Now, Doctor, do you confirm the correctness of your report?
Yeah, in terms of the way in which the report is being done, I would say I treated it as a standard case, and then I did. There wasn't really much to really go on. The patient has any dental related facial situations that I encounter. I would say it's kind of really examination, and this is how most of the patients that are close to fair oral examination done, the standard that we do. So I do confirm the correct.
Ngoba ke lana ngendlela ke ayo ke kubona ke ama patients lokhu okuqulathiwe noma okukhona ke la kule document ke ngiyahambisana nako ukuthi iqiniso.
Now, doctor, you testified examine a person from the waist up. You examine the head. You examine the oral cavity. You inspect the face. You look for lacerations. Examine the nose, and you also examine the neck. Is that correct?
Ngishilo ke ukuthi lo muntu uqala khuphuka amakhala entanyeni ngambheka futhi ekhanda ngambheka ubuso ngishilo lokho eqaleni.
Now, allegations have been made that patient assaulted, shoot, was electrocuted some days prior to your. Now, what would your comment be given your clinical examination and clinical findings?
In terms of assault, electrocution, since the I'm going to conclude that when you look at a patient since it was clothed, unless if from our assessment, unless if the patient was being assessed maybe by a general practitioner, let me just say, we call them general practitioner or medical officer. That's when maybe underneath the clothes upper torso they are allowed to. But from the appearance, what I could see from the patients, since the actually, I remember they were not wearing any jumpsuit overall. They were wearing usual clothes, if I could remember. So from what I could see on the surface, not underneath the clothes, I didn't see any sign of electrocution unless it's underneath. As for choking, the person's they can prolong, as we always say. It depends on the length, pressure, and the stress the individual was pressing on the patient.
Lana ke kuneyinsolo noma kuneyinsolo ezithi lo muntu lona lo muntu lona ke wa banjwa ke ngogesi futhi lo muntu futhi ke waqinywa ke uthi ke mayiphendula ke lana ke ngoba wayegqokile ke ngaphandle kokuthi mhlambe wahlangana ke nodokotela ke yena ke wamcela ukuthi ke akhuphuleke ingubo le noma impahla lezi ayigqokile kodwa mina kulokho engangekubona ke ngekho ke impawu eyishoyo ukuthi kwenzeka ke lokho futhi ke nokuthi umuntu aqhinywe ke nike kuye ngokwesikhathi ukuthi lokho kwenza esingakathi kanye futhi ke indezi make ipressure eyafakwa ke lapho loyo
markings of chokings, as we were taught, markings on an individual. Show in terms whereby it also relative to a patient's skull. That people, they are choked and they are pressed on the vehicle. It has to be at a certain severe point to show. But if it's a fair person, if you choke, press their neck, there will probably be a depression if it was hard enough to lead to a patient gasping for air to a point whereby they will end up losing oxygenated blood supply to the brain. It will eventually show on the neck. And
safundi tshelwa ngayo ke kuya ngokuthi ke umuntu ke uyibala elinjani ke kulapho ke ongathi ke bona ke badakhe ke uma futhi umuntu ecindezelwe ke kodwa kulabo ke abakhanyayo ke kufanele ukuthi ke bona ke isikhathi ke esingakanani umuntu noma ke lokho kubona ke kuzoba khona ke okubonakalayo kuyena.
So in this case, when you look at the patient, as far as choking marks, when I was palpating the lymph nodes and checking the assessment, there were no prominent choking marks. But also given that the patient was 3 days late, it's been even in normal terms, we call them love bites. They can at least over a week. If a patient actually pressed, whereby a hic is made in terms whereby if a person maybe was in a way in which were let's say of vacuum, or they were placed, they were pressed. So about a week or so, if they were done properly, or also if a person was choked and there's depression marks.
But ukuthi lo muntu ufike ke noma ke patient izile ke kwisikhathi seyinsuku noma amalanga ke amathathu ke futhi ke uma kuukuthi umuntu uqenyiwe ke noma lo abizi ke ukuthi ke amahikishi noma ke ama-bites ayahlala ke emuntwini esingangeviki.
So in this case, there were no certain marks that showed that maybe the patient was really choked. And as for the face, there were no lacerations, or also the patient was kind of really beaten up. It looked like it's a normal individual that doesn't look like they were in any severe physical altercation, unless the altercations were done anywhere else other than from the neck upwards, and also underneath places because the patient was clothed. But what I've seen, appraisal of the patient didn't look like a patient was in any sort of state that they were done, such as if these things that were done on them, trauma to tissue, especially on the body, was done that is underneath the clothes that I couldn't assess and see. But as far as the face go, the eyes, the way in which the neck was, and when you look at also the state of the teeth, it didn't look like this person was actually maybe severely beaten. It looks fairly normal.
Kulezi noma ngibona khona mina kwakungekho nje okuyinkomba noma okushoyo ke ukuthi la intamo ke lokho engikubonayo ke ukuthi lo muntu lona ke khona la ekwangquzulana khona ke noma ke ashaywa khona ke ngaphandle kokuthi ke ungasho ke ukuthi lezi engayiboni indawo la awayegqoke khona ke noma la engangaboni khona ke, kodwa kulokho mina engangikubona kwakungekho nje okuyinkomba nokushoyo ke umuntu lona ke shayo.
What was this patient posture when you were examining them? Did they show any signs of pain, of discomfort?
They were coherent. They were talking. I remember since my Zulu was shaky, the assistant was the one who had to assist with the translation of the Zulu language, and fluently. I think at some point giggled. To me, it appeared as if it's a person who's more of worried than a person who's in distress of pain from the general perspective. of view. And also the other thing that was also there is they could be further referring the patient further on the body down, because from what I've seen, the patient really looked normal, and I wasn't indicated that the patient maybe probably is a trauma patient or what. I was given a fair chance by the police when they said look for a certain thing. So when I decided to look for a certain thing, the patient has had a more fair chance of me, a bias of the patient. I was looking for something and also checking other things. So meaning, or if I was pursued, whoever, maybe my findings would have been maybe a bit more skeptical, but I was given a fair chance to examine the patient. Fail.
Kwake isikhathi ke lana ke ekuyisineleke ukuthi patient lena ke ngiyibhekeke futhi ke ngendlela ke ekuyiyona, ngoba ukubuza ukuthi ke ingabe mhlambe uma ke usebenza ngaye ke kwakhona yini la atshengisa khona ke ukuthi khona la ezwa ubuhlungu khona ke uthi cha lokho ke akuzange, nokuthi futhi ke inkinga yami kwakuwukuthi ke singekho kahle manje ke lo owayengilekelela ke uyena ncedisa noma engisiza ukuthi ke angiphumushela noma angitoli kuyena, futhi ke kube khona nala khona ke ahlena ke i-patient lena ke, ngoba ke ngatshelwa ke uma elethwa ke ukuthi angibhekeni lokho ke nami engakubheka kwakuwukuthi ke kwakhona ke okuwukunye mhlambe ngangizomdlulisela dokotela ke okwakuyena owayezombheka, kodwa ke akukho nje okwakhona noma engakuthola ukuthi uneyinhlungu ayizwayo.
Did the patient tell you that he was assaulted? Did he make any assertion that he was assaulted?
The patient didn't state any sort of situation that maybe they feel they were assaulted in anyone. They didn't. So the only thing they stated from what we have from the report, it's them admitting that they had a heart condition in the mining accident that they had in 2014. And in regards to that, they didn't state that.
Akashongo ke kumina ukuthi washaywa noma khona la ashaywa khona ke okuyikona nje angitshela kona ke yiloko okumayelana ke nenhliziyo lena ke noma isibongo lethi senhliziyo asithola ke noma kade naso ngo-2014.
And finally, Doctor, you mentioned that if something is not within your scope, you refer it to the relevant discipline, for instance, severe injuries. Was there any referral in this particular instance?
In this particular order, I remember the whole event. Immediately after seeing the patient, they asked the warden and the police, or are we done? Is the patient supposed to see someone else? And the thing is, where we work, the patient can't pass through the medical side and goes through to the dental side without the medical people referring the patient that side. Meaning, when the patient, when they got there, they go to the reception area. A file was opened. Then when they took vitals, when they got there, when you take vitals, the nurses that take vitals, they also end up asking the patient, or are they specifically came for side? And also, I think maybe in this case, they asked the police, they came to the dental side, or they're going straight to the medical if they have any part of their body that's undental, that's not dental related, that needs to be done.
Umshushu sifuna ukwazi ukuthi ke uma ngabe usuqedile ke ingabe kwakhona yini la kwafanele umdlulisele khona ke. Ngiyakhumbula ke ukuthi ke iphoyisa kanye nosojeleke lona ababemphelekezela ke bangibuza ukuthi siqedile yini noma khona la ekufanele siye khona. Umephendula ke udokotela uthi uma uza lapha yana ke kuthina ke akukho la uzovele nje uze ngo noma uzofika kumina ke ungandlulanga e-reception, bona ke onesi noma abahlengikazi ke khona lapho ke bazobheka ke futhi bakubuze ke ukuthi uze kudokotela wamazinyo yini noma kukhona okuzele ongahlangena nomlomo noma amazinyo okumayela noma okuphathelene nomzimba.
So that, therefore, it means that the patient, when they came through to us, usually even if a patient, in cases where a patient has trauma cases, they first initially go through the state we're talking about. BPs are taken, they refer them to the emergency area, they check if blood pressure is stable, have they lost any blood, have they lost any fluids. When those are stable, they send them to our side due to the fact that they notice or maybe the patient has some facial issues that are there, so we can assess them and make further referrals, meaning we will probably have to send the patient to a maxillofacial, which is a specialist that deals with the neck, head up, in restoring it in severe trauma cases. So we, as IFIN, we are the last people that see in any healthcare situation. It doesn't matter if the patient was in an accident. If the patient was even in a car accident, they treat every single thing. They check and then they leave the part of the jaws that are broken, the teeth that are broken. Afterwards, when the patient is stable and the patient is coherent, it's fine. That's when they refer them to the dental side to have those treated, because we always say we start with the severe situation that are life-threatening. So if it was a case whereby maybe the patient, the jaw was broken, and the tongue's position was shifted, it was swollen, it was going at the back of the throat, that's when maybe it will be referred to us, or we quickly need to take them to a maxillofacial so that that jaw gets rectified, so that the patient is not at life-threatening. But if it's not that case, when they come to us in treated state of certain things that they needed to have done in general of the body to us.
Thina ke sikabogqita ke khona laphayana umuntu azofinyelela kubona ke ngaphandle kokuthi ke mhlambi isimo njena ke sibucayi kakhulu ke la khona umuntu futhi ke masithi ke ulimi ke selihlehlele ngasemuva ke kufanele azoqala kuthina ke sibe sizamdlulisela silungise noma senze isiqiniseko sokuthi lapho ke usetholile ke usizo, kodwa ke thina ke sikabogcina umuntu eza ahlangana nabo ke ngoba kufanele konke kwenziwe laphayana ngaphambilini babheke konke, babheke i-pressure ke yegazi, bambheke nje isimo sakhe ngaphambilini kokuthi ayofika thina.
Is there the standard procedure that you've just described?
The standard procedure that we had at the medical center, and is the standard procedure that in most cases they are supposed to be followed in any trauma individual case. The thing is, they go to an emergency room when they come for trauma that has happened. They get assessed there for life-threatening conditions that are there, which we're talking about, or if they are bleeding severely, if there is the blood pressure is up, whether the patient is conscious, whether the patient can talk, whether the patient has those, they get assessed there, and they make the patient stable before they could go for any other discipline, which are called the rehabilitation part. We are part of the rehabilitation part. So if a patient comes straight to us, that means already the patient has no abnormalities that they could notice. They're just sending them for normal dental assessment that we could do. Unless if it's in a case whereby it's in private, whereby a patient comes because they got assaulted in the face and they see a tooth is sticking at the back and their jaw is not sitting well, they will say, let me go and see a dentist to fix that. That's when they in private, that's when they get to me, I'll say, I can't touch this, I don't know what's really happening to you. I write a referral, I send you to a hospital.
Indlela ke ekwakwenziwa ngayo, indlela ke ekufanele ukuthi nabona ke kwenziwa noma ke izinto zihamba ngayo, ngaphandle kokuthi bona ke uma besemtholile bembonile ke babonile ukuthi asikho esinye isimo abamdlulisele kithina ke mina ke bese ngiyambheka ke uma ukuthi nami ngiyathola ke kukhona la ekufanele ngimdlulisele khona bese ngenza lokho.
So in other words, doctor, you're saying that a comprehensive medical assessment is performed on the patient. They take his vital signs, check for trauma, thereafter the patient is then referred to you.
Yes, that's a part of the last part of the examination, which is most cases it's rehabilitation, just as fixing what's broken regarding the patient's oral cavity or what we can't fix. Then we send to someone who's related to, so we can close proximity with us.
Thina ke siyabogcina ekufanele silungiseke lokho kuyikona ekufanele sikulungisa uma kuwukuthi ke kuyinto ke esihlulayo ke yila esidlulisela khona ke.
Thank you, my lord. That will be all.
Yes. Yes, any cross-examination?
Sir, my lord. We proceed or adjourn, my lord.
Pardon?
I was asking if are we adjourning or proceeding.
I don't know.
I
Me,
only have one or two questions for the witness.
what's your time here?
25 to 1.
You want us to adjourn, sir?
No. It's only one question or two, my lord. That's unless other colleagues are.
Your colleagues, anybody wants us to adjourn? Because he wants to prepare something or think about something?
I am fine, my lord. You can proceed. Speaking for myself, of
Okay,
course.
Mr. Ngomane?
We can proceed, my lord. Thank you.
My lord, I would ask that we take a short adjournment before we proceed with the cross-examinations.
Okay, how long?
10 minutes, my lord.
Are they not having lunch, this gentleman?
I think we can come back at about, quarter 2 and then adjourn at 1.
What's the time? Who said the time is
It's 23 minutes.
past?
23 minutes to 1.
I'm thinking about lunch. Don't they have lunch at 1 o'clock?
Yes, so we can resume at quarter to 1, then adjourn again at 1.
Oh, okay. We come back at quarter to 1.
do was to check if he had a gold teeth or not. Was that something conveyed to you by those police officers that brought Ntanzi to you?
When they got there, the thing that was conveyed to me when I asked the reason, the main reason why I'm supposed to examine the patient,
Yes.
they did state they would like to know, and then also I was not informed what type of a case it is, what was happening. They just informed me that I should examine the patient and also check if there is, the patient once had a tooth, if there is a tooth that chipped off that shows signs that there was a gold tooth or not. That's what I was conveyed to initially.
Eqaleni ke uma befika ke umbeli ufuna ukwazi ke ukuthi uma elethwa kuwena ke uNtanzi ingabe kwathiwa kuwena ke awubheke ukuthi wayenezinyo legolide noma cha. Uma befika ke bathi kumina ke angibheke ngangazi ke ukuthi ke icase yaluphike uhlobo ukuthi angibheke nje ukuthi ke unezinyo ke elakhishwa noma ke izinyo legolide yebo noma cha.
So after your assessment, I just want to establish whether what gave you or who gave you the power or the authority to examine accused number 2 in terms of general examination. Was it the consent, was it given to you by accused number 2?
When they came in, number 1, they brought him in and then they explained to us what's happening, because it's the protocol that we follow when prisoners are coming through, that we need to speak to the police or the wardeners to find out what the patient is in for. And then from there, we speak to the patient and tell them, or we're going to examine you in relative to our standard. So it's up to the patient to say, okay, I want to be examined or I don't want to be examined. So we do say to tell to the patient that we are going to examine you. The patient also has the right to say they don't want to be examined or not. But in this particular fashion, because they were brought by the police and the warden, when you look at it, I would say in any case, in scenario, since the patient was taken from a prison and was brought to us, it looks like maybe that's something that was maybe authorized by the law, authorized maybe by a higher order or whatsoever. And then, but when we convey to the patient, if the patient does continue agreeing for us to assess them, we take or the patient doesn't have any sort of issue with what we're doing.
Maqala ke babengena ke umuntu elethwe ke labo ke basejele kanye futhi ke namaphoyisa ke siqale sikhulume nabo ke sizwe kube yibona ke abasitshelayo bese nathi ke siyayikhulumela ke naso isiboshwa ke leso simtshele ke ukuthi ke manje sesizobheka ke sizohlola ke kuba kuyena ke umuntu loyo ukuthi asho ukuthi cha angivumi ke ukuthi ningihloleke noma ngiyavuma kodwa ke nayo unalo ulungelo noma uyanikezwe ilungelo lokuthi avumeke ukuthi singakwenza lokho noma cha futhi noma ubheka ke isimo ke noma ke kangendlela ke alethwa ngayo ke awazi ke noma ukuthi mhlambe kwakuyi instruction noma ke igunya ke elapho yake kwaba ngaphezulu ke lelo.
Now sir, I'm concerned about the privilege between the patient and the doctor. I cannot assume a privilege because, may I just establish, before you examine accused number 2, did you meet with the police first in the presence of Mr. Ntanzi?
The police, how it works in the system that we have, with patient queuing outside, in general as point of view, né? Then when we have a patient queuing outside, patients come through with a line. We don't see any patient or talk to anyone prior to the patient actually entering into the exam room, because we're trying to avoid conflict of other patients coming in while we're still with other patients. So when the patient came in, when we started talking to the policeman, the patient was there. And there was no point whereby, I'm confirming there was no point whereby I was called into the corner and I was told directly when the patient was there. Maybe the patient, in my recollection, the patient was sitting was not sitting on the dental chair, was sitting in the chair that we usually put parents or guardians for minors to watch over their kids as we are going through operating them or we're examining them.
Engakusho ke lana ukuthi ke ngokwenjwayelo ke siba nabantu ke abazoma ke emgcini lapha abalinde ukuthi ke bangeneke ngoba sigwema ke into yokuthi usene patient ngaphakathi bese kungena enye ke kodwa lana ke okwenzeka ukuthi ke uma ngikhulumisana ke nephoyisa leli kanye nosojeleke ipatient leyikhona ke ila ngizama nje ukunikeza isiqinisekiso ke sokuthi akukhulunywanga nami noma angibizelwanga ekhonyeni kwakhulunywa nami kodwa kwakhulunywa nami ipatient ikhona kunesitulo ke esilaphayana esivamise ukuthi ke sihlale umzali uma kuukuthi ulethe umntwana omncane wayekhona elapho nkathi ngikhuluma nephoyisa.
So there's one answer that I asked from you, sir. Did Mr. Ntanzi give you a consent to examine him? Yes or no?
Consent in terms of them saying or we ask.
In terms of examining him,
Yes, we
did
ask.
he give you the consent?
I
to
would say we were given because we ask, the standard is we ask the patient. We tell the patient that what we're going to do, if they are comfortable with it, or we should go through with it. Before anything, in any standard, when we examine a patient, we tell them what we're going to do. Explain to you, I'm going to check you first, and I'm going to check for, I'm going to examine you, I'm going to check for any sort of deformities. Do you agree? That's standard. Do you agree? And then the patient, if they say they do agree, then that's when we proceed. Because a patient, any patient who's above, we say it's a minor if they're under 18. If they're above 18, it's considered an adult, they have the right to say no. So the patient did allow me to assess them. So
Yebo
in
ke
a way,
ngacela imvume wanginikeza imvume ngoba ke ngiyambuza ngiyamtshela futhi nokuthi ke yilokhu engizokwenza kuwena uyavuma noma yini ke ngoba lo muntu la sikhuluma ngomuntu ke ongaphezulu ko18 kuba ingane ke uma engaphansi kweminyaka ewu18 ukuphendula ke yebo wanginikeza ke imvume yokuthi ke ngaqhubeka ke.
Did you have a consent form that was signed by
the consent form
Yes.
that usually comes, ne? This is a file for the dental. When a patient comes in the I would have indicated that they should have gotten a standard form that they have. Remember the healthcare center, when the patient arrives, we have a file, a bigger file that comes in for us, whereby it has even things from the
Sir,
medical
sorry,
side.
I understand you want to explain. Did you have a consent form that was signed by Mr. Ntanzi?
The form, yes, we did have the file. In the file, there is a consent form that explains the patient agrees to be signed.
Are you
and
in
to be
possession of that file?
I don't have the file.
Yebo ikhona ke iform ekhona uma sithola ke ifile la assign khona
Sorry, Mr.
ngisho
Mgwezulu.
ifile anginayo.
You mustn't accuse me of giving evidence. Just have a look at this.
Sorry.
Because you are the ones who gave me this as an exhibit which was going to be utilized by Mr.
Yes,
Maloi.
I'm quite aware. Page 4, the witness did testify about the consent and the signature. of the
Yeah,
witness.
well,
It talks about the signature here. It
you
talks
haven't
about.
read that. Let me read it. Just bring it. Oh, my God. Consent form. I, the undersigned, hereby give permission for dental treatment to be performed on myself, not my child. And then they say name. I have been informed and understand the benefits and burdens of the proposed treatment and treatment alternative and the option of no treatment. Then it's signed by somebody here.
The logic, my
No, no, it's okay. You
Yes,
can go
my,
on.
my logic, the logic that I'm trying to converse on there.
Okay.
The form was signed after
No,
the
no, fine.
examination.
Go on, Mr.
Yes.
Ngomezulu.
If it was signed before, or I'm putting to you that accused number 2, when he was brought by the police, he was in the car and he was under the guide, or he was escorted by certain Metropolis officers. When the officers that spoke to you entered the surgery,
I'm going to explain. When in the operation area that we work in, I only encounter with the patient when they have gone through certain people. Before they even get to me in the dental department, they need to go through our receptionist, the one who has a book that writes them down. And then they interact, whoever, if it's a guardian or whatsoever, they interact with them. When they come to me, I am only going to see the patient on the basis that they're going to just inform to me, or we have a patient. In that day, they told me, or there is a present patient, the policeman spoke to me, or you need to assess them. And then in most cases, I don't even ask for what it is for. I wait for them to come in and inquire with the people that are coming in, because most of our HR people don't really know what needs to be assessed from those patients. So most of them times they get the things wrong. So they always say there's a patient who's came in, especially patients that are from prison. Even when we were still in school, when we have patients that are coming from prison, they inform us when we have a patient, and then we speak to the policeman after, when they've already seen those HR people
Say,
with the
lana-ke
patient.
okwenzekayo ukuthi kumele uthi-ke ummangalelo wesibili-ke bayihlezi emotweni kanye-ke namaphoyisa-ke i-MPD, nkathi-ke wena ukhulumisana nephoyisa likutshela-ke laphayana uthi okwenzekayo-ke ukuthi labantu laba baqala e-HR HR lapha kunefomu-ke ekufanele bayigcwalise bese beza kumina-ke mabeza kumina-ke futhi-ke mina ngibona-ke abangitshelayo ukuthi-ke kufanele yini-ke abeze ngayo noma abazoyenza.
during the examination in chief, you said the police officers informed you to check a specific thing.
When they arrived,
Yes.
initially with the accused, when they got into the waiting area, this is protocol that we do when it comes to prisoners or people that are being sent to us from a certain governmental institution. We need to talk to the person that brought in the
Yes.
prisoner and then ask them, what is the patient here for? And then they have to inform us what the patient did, confirm, or they have a tooth that's broken, that's swallowed, and then from there on, that's when we proceed to talk to the patient. So now with me, the police corps just told me from their view that, look, we have a patient here, we have a case, we want you to either confirm if they had a gold tooth or they didn't have a gold tooth. So that's what I was told when the patient was there in the present. Then I continued to proceed to talk to the patient and telling them, or no, what am I gonna do? I'm gonna actually examine you. So you're gonna sit down, I'm gonna examine you, I'm gonna examine the mouth, and also I'm gonna check certain things from you. And then the patient did say and agree, okay, no, it's fine, that you can do. And then I did do that.
Okwenzeka-ke lana ukuthi yebo-ke amaphoyisa-ke elikhona elaphayana engitshela-ke ukuthi yini ekwakufanele-ke ngiyenze noma engiyibheke-ke nokuthi ngenze isiqiniseko sokuthi wayenalo yini izinyo legolide noma cha. I-patient ikhona ihlezi lapho, emuva kwalokho ngase ngikhuluma naye-ke ngimtshela-ke ukuthi ngizokwenzani noma kwakuyini-ke le engangizoyenza kuyena lokho kwenzeka ekhona.
Let me just put it this way to you so that you understand. In relation to the information you gave out as a doctor to examine the accused was not the scope upon which you were, accused number 2 was brought to you. You exceeded the scope.
Remember in my explanation, when you look at the file, the form that we have, the standard, I was going through the file word to word, explaining every single thing that was there. And then if you could notice, every single thing that I spoke about, it's within this file. I never went above and beyond to write anything that was not within this file.
Ummeli uthi-ke wena-ke kulokho wakwenza, wena-ke wenza wase uyeqisa-ke kulokho kwakufanele ukuthi uyakwenza. Uma ubheka le fomu-ke enginayo la phambi kwami eninayo-ke nani ukuthi-ke ngenza konke ngale ndlela ekungayo la, akukho la engabhala khona noma-ke ngase ngengeza okunye okungekho kule fomu ephambi kwami.
You are not a pulmonologist.
That one, well, we are well aware, but remember,
You are
everyone,
not a pulmonologist. Is that so?
yes, I'm a dentist. Everyone that goes through medical school, we are supposed to learn the basic function of the body. meaning you have to be able to, when a patient arrives to you, know the most basic facts of every single thing that's been done. It's noticing the basic things. This is why we were taught, in order to be able to identify if there is an assault patient that was, even if the patient, for example, even if a child is brought to me by their parent and saying, well, they fell, I'm supposed to, as an individual, look at the whatever it's been said is correlate with what the patient has said. If I see any marking that shows that the child is being abused, I'm supposed to, as an individual, address to that and then take steps, maybe in contacting a social worker or something that's that. So the reason why we are taught that, we are taught to notice bruises, to know the heart blood pressure of an individual, whether it's high, whether it's low, what does it indicate? And then based on that, we conclude whether the patient from our side, it's normal or it's not normal. That's why we check things like high blood pressure, and these things, these readings, they are brought to us by the nurses that do these things, and then they bring to us. For example, if a patient comes in with a high blood pressure into our waiting area, we're not going to see them. We're definitely going to write a referral and say, refer patient to emergency so that the blood pressure can be stable before we see them. That's the protocol, meaning that we need to know the basics about how the pulse is, how the high how the high blood is, how the sugar is, and also the whether the patient appears
Even
to
if
have
we were
any
taking
infection.
notes, we will not be able to take notes because just
I don't
My question-
understand. What are you saying?
my lord, I was saying even if we were taking notes and he's talking medical terms and what is quick and we can't follow him. So I want to confine him in terms of legal aspect. It's lunchtime. My lord, it's lunchtime. I thought I would have one question, but I see that there's so much to do now. May we adjourn, my lord, for lunch?
Okay. Hello, are you available after lunch, sir?
I think I was supposed to be available until 1:30 because there are some family responsibilities I need to attend today.
Are you comfortable?
Huh?
Are you comfortable counseling them and testifying here, or you want us to excuse you? Come on Monday.
I think already it's fine. I will just wait for 2 o'clock because on Monday I might not even be around this.
Oh, okay, fine. 2 o'clock then. You may have an idea why I'm late.
Let's not disclose that.
Oh, okay, thanks. Yes, Mr. Mgumezulu. Mr. Kubek.
Thank you, madam. Sir, I would request you to follow the question and answer what is asked. Eh? All right. My instruction from accused number 2, Bongan Tanz, is that when he was brought to you, you only checked him, his mouth. You conducted that oral cavity check, or you never examined or asked him anything relating to his health or medical status.
I'm going to be brief and straightforward, as you said. I should avoid answering the question directly. Look, according to this, you don't go straight up to treating a patient without asking any sort of medical history that's there. So what I did is we need to check the medical history of the individual before touching or even doing anything with them. We need to know whether they are sick with certain things. That's standard protocol in even any medical profession. Whether you are a dentist, whether you are an optometrist, you need to check that. So I did that. It's on record whereby I marked it and then the patient also signed. So from my recollection, I did that.
Ubongani Ntanzi uthi ke wena ke wambheka ke noma wamhlola ke umlomo kuphela awukazi umbuze ngesimo sakhe ke sokuthi ukanjani ke ngempilo lana kuthina ke awukwazi ke ukuthi ke noma uyiphi ke inhlobo kaDokotela ukuthi ungavele uqonde nje odabeni nomuntu kufanele wazi ngomlando wakhe ke ukuthi ke ukanjani ke impilo yakhe akukho yini okumhluphayo ngenza lokho ke nami yilona le form leli eliphambi kwami.
Okay, regarding the HIV status, did you warn him that is not obliged to divulge his medical?
As I stated when I was stating here that we ask the patient that do they know their HIV status? And they said they are not aware, they don't know whether they are positive or negative. That's what we ask. We don't say whether the patient has the right. The question is, we don't say, are you HIV positive or are you HIV negative? We say, do you know? And if the patient decides to say, yes, I know, and then that's when we proceed to saying, or then would you like to disclose? But if the patient just said they don't know, we're not gonna say what really happened. Further on, the things that we ask further on is, have you ever been tested? And then when the patient starts to say, no, I've never been tested, we leave it at that.
Mayelana ke nombuzo lona ke ophathelene nayo ke ingculaza ukuthi ke ingabe wami exwayisa yini ukuthi ke akaphoqelekile ukuthi aphendule. Lana ke wathi uma ngimbuza impendulo yakhe yathi cha angazi. Uma ethi ke angazi akukho ke okunye osungaphindi ukubuza. Kodwa ke uma impendulo yakhe kwakuwukuthi yebo ngiyazi, kula usomxwayisa khona ke manje ukuthi noma usho kuyena ke ukuthi ungathanda yini ukudalula ukuthi ke sithinike. Kodwa uma ethe nje cha akazi awukwazi ukuthi ungaqhubeka ngayo.
All right. Did you check him? Did you check COVID on him?
During the time they
Yes.
passed through the screening
Did
process.
you
They-
check COVID?
Listen, they pass through screening. As I've already mentioned, that the patients before they get to us, they go through number of exams. It was COVID times. They go through the reception, they see the nurses, they do the blood pressure, and then they also do COVID screening. And they do that at a separate location. When they come to us, it's a patient that's clear of the screen of COVID, and also with the HIV screen, they also do the same thing. They ask them if they want to test, they end up testing them. So those things, screenings are done by the nurses, which we say is the vital group that does that. So they screen them for that. So there is no patient who will pass the vital group, come to us with signs of COVID. So there are people who at the time by the government appointed to screen any patient that comes through there for COVID before they even get to us. My point is the patient passed through a number of people before getting to me.
Ingabe ambheka yini ke umskrini yala yona ke iCovid uthi lokho kwenziwa ke uma bengena ke lapha yana ke akangeke ezofika kumina ke kungekabhekwa konke lokho baningi abantu abadlula kubona ke lapha yana la kwenziwa iskrini khona kubhekelwa yona ke iCovid ngoba ngaleso sikhathi vele ke kwakuyisikhathi seCovid nayo ke iHIV nayo ke uyabuzwa lapha yana uma kukuthi umuntu unquma ukuthi ke attestwe ke nalapho kwenziwa khona lapho.
So was this form completed by yourself or by the nurse? The one that you were reading?
The form has two handwritings.
Yes.
The first one on top, if you notice where there's written vitals, that's not my handwriting. You give any expert, handwriting expert, they will tell you there are two people who are writing here. The protocol is names, surnames, and including patients' contact details. They are done by the nurses there. And then the rest of the questionnaire, which is the questionnaire, the exam, the other part whereby we do the extra exams, it's done by us. So every detail that requires the patient's personal details and also the vitals, which I've already pointed out, if you can look at the form, that whether it's written BP inside here and also the time, it doesn't correlate with the other handwriting, which is mine. So meaning that this patient was seen and also the form was filled by the nurses. That's the protocol. They fill up the personal details. When they get to us, we only do the medical side.
Lana mubheka ke kule form lena ke ukuthi ke ama handwriting ahlukile ke lapha eqaleni lapha yana kubhala imininingwane yakhe, igama, iminyaka, kunama number, kunekhili lokho ke kwaqaliswa amanesi lapho aqala khona. Ukuhla ke enzansi la kubuza khona ke imibuzo noqhubeka ke neform ihandwriting yami.
And it is tell me, in terms of that form, where it is indicated that the results after you check the COVID were positive or negative?
I'm going back.
Sorry?
I'm going back to what I said initially. This, it's a dental form.
Yes.
When a patient comes to the healthcare center, there is a file that's in brown and it has lines, it has different disciplines inside. The form that now I'm given here is for what I did. I did go through the rest of the form, and then the rest of the form is, when you go through them, you check whether the patient was screened for COVID or not, and then you send them back if they were not. We do receive it as a hard copy. Once we are done, we remove our part from the dental part. We store this part inside there. And most of the time when we store it, it's stored inside a system whereby it even has a correlating number with the actual document that's being kept by the medical side. This is done in order to avoid any complications between the dental side and the other side, because the patient might come back a week later with an appointment to us. We avoid the patient waiting in line again, trying to relocate file. Instead, the patient goes straight to us, and then we retrieve this file.
Ingabe lana kule form kukhona la yini khona ke kushoyo ukuthi wabhekwa ke ebhekelwa yona ke iCovid. Ngizobuyela kamuva ke noma ngibuyele emuva ke la engishilo ke khona ukuthi ke kune file sithola ke ifile kuleyo file leyo ke kuneyinhlaka ezahlukeneke la echazwa khona ke ukuthi lokhu ubhekelwe nalokhu ubhekelwe bese thina ke kuleyo file le uma seniqedile ngikhiphe eyethu ifile noma lena iform lena ngithi ibeke ecaleni la igcinwa khona ke kwenzela ukuthi ke uma ngenzeke kule ipatient ibuye futhi ke kungabi ke nokunqobuzana ke la khona ke ezophinda futhi ayoma ke emgqeni kodwa ke lo muntu ebekade ekhona la.
The fact that I put it to you that you acted beyond the scope of the instruction, I'll just leave it for argument, but I'm just concerned about where you indicated that accused number 2 said he had a heart problem in 2014. It was an incident from the mine. And you further said that it did not take any medication in relation to that. When you were told, you said you were told by accused number 2 that he had a heart problem. Is that what you say? Were you told by accused number 2?
And then I'm going back to the form that I have. If you look at the form, the things that you're asking me, they're basically almost answered here. the health questionnaire asks if the patient had any sort of heart conditions or there are any sort of medication.
Yes.
So I need to ask those things. It's not beyond scope. It's beyond what the form
The question
is
is,
saying.
were you told by accused number 2?
Yes.
Yes, that's what I want.
Yebo ngatshela uyeke ukuthi wayenenkinga ke inhliziyo ekwenzeka ke emayini ngo-2014.
My instruction is that accused number 2, where he was working, he's working underground. And no one can work underground. You can comment, you cannot comment, but this is what I'm putting to you as the instruction of accused number 2, is that if you have sicknesses or chronic illnesses, you cannot work because it's too hot underneath. Any person with medical defects cannot work there. So he denies having informed you that he had the medical.
Can I add? In regards to what you're saying, it's true. There's no denying in that. But also there is also a fact that most of the people that work underground, the studies that's been there, and also if you look up through the internet, you'll find it. Most people that work underground, most of them, they are always checked through for if they have any sort of defect or whatsoever. But did you realize that there's a fact that if a patient has a high blood pressure, what the mines people do is they send the patient to a doctor so that they can have that rectified and managed before they go back underground. It depends on the severity of the situation. So in the terms of, that's now what I was informed, and that's what it came from him. That's what he said. So meaning that yes, he could have had a mining incident. We don't know whether it's minor, whether it's major, and then after a while, and then the patient was fine, and then they went back. So those things are the things that any logistics from the mine that we know, because when I was working that side, we used to have clients that they would basically almost, when I interacting with my colleagues, that they would come, they need to be checked, they need a medical certificate to show that whatever they had, it's not serious, they can go back underground and then work.
Yes.
Wazi ke ukuthi kwizimo ke ekusetshenzwa ngaphansi kwazo emayini ukuthi ke kuyashisa laphayana angeke umuntu asebenzeke enesimo esenhliziyo kungayiqiniso ke lokho okushoyo kodwa ke kuyenzeka ke futhi amahlandla amaningi futhi ke lokho ke seku boniwe ke noma ama study akhona ke ashoyo ukuthi abantu bayasebenza khona laphayana ezansi kuya ngokuthi isimo siyalawuleka noma ke sikanjani ke abanye bayeza bazobona udokotela umuntu azothi ke ngicela nje incwadi ke yokuthi nje babone ukuthi lapha manje isimo sami ke sesiyalawuleka ke ngingabuyela ngaphansi so kuya ngokuthi isimo leso sikanjani.
Yes. Let's get into the point where you say, when my colleague was asking you about assault or if somebody alleges that he was choked. According to you, are you in a better position to see if somebody has been subjected or he was choked? Because I don't want to, sorry, let me just clarify this one. Unless the instruction is that the accused was not strangled. I want to make a distinction between the two. He was not strangled. According to his version, a plastic bag was put over his head when he was choked. A plastic bag was used. Will you able to see if a patient come to you that this person was choked?
In a normal state, any patient that was choken with a plastic bag, unless if the only person that can be able to say the patient was choking in a plastic bag, in medical terms, from what I know, the only evidence that can show that a person was choked in a plastic bag and then actually there is a sign is if a patient succumb to whatever the plastic bag was. If they was choked and they end up passing away, that's when only the autopsy from whoever's doing that, they'll be able to identify that. A choking of a plastic bag over the face, yes, ligature marks, if it was pulled hard here, there will be lines. Any plastic bag, if anyone, even right now, you take a bandage and you wrap it around your hand and you pull it quite very strong, it will leave a mark.
Uma ke ukuthi ke wafaka ke plastic ke lokho ke la ekungathola noma kubonwe khona ke ukuthi ke mase sithi ke umuntu ke mhlambe usuyashona ke ngenxa yalokho uma sekwenziwa yona ke i-postmortem kuzobonakala kodwa ke uma kuwukuthi yona ke leyo plastic iboshiwe ke khona lana ke yasiyaqiniswa ke kunama mark ezowashiya ngisho nawe uma ungathatha ibandage khona manje uyibophe khona la kuwena ke kuzobonakala noma ke khona lokho okuzosala.
Before you continue, let me add, in that term means that even if there was a mark by a plastic bag, after 3 days later, when the patient came to me, that mark would have eventually been faded or have actually disappeared because of the fact that these marks that we are talking about, they are not severe marks that could last for long. Plastic bag doesn't have enough power compared to a rope.
Futhi ke asithi ke manje lo muntu uzileke useze emuva kwamalanga amathathu ke lawo marks lawo ke kusengenzeka ke ukuthi ke ase enganyamalala ke ngoba ke iplastic yona ke ayifani ke ama mark ayo angeke ahlale ke ngokufana nayo ke intambo.
Yeah. All right, no, that one is not his field. Before I just want to be straightforward. When you first saw accused number 2, Bongan Dance, he had no visible injuries. Did you see any visible injuries?
From my point of view,
Umbona kwami ke mina ke akukho kulimala okwakubonakala loba okwakucaceleke engakubona kuyena.
And you did not ask him to take out his clothes?
no, I never did that.
Angizange ngimcele nokuthi ke aphumuleke owayegqokile.
And tell me the time in which they arrived. And what was the time accused number 2 was brought to you? What exactly time was it?
It was right precisely towards lunch. I think I remember it was towards maybe 1 o'clock. I think it was around 12.
Ngizothi ke ngaboma 12 ke kodwa nje ngaphambi kokuthi ke kushaye ihora ke lokuthi ke kube isidlo ke sasemini.
So that's when you
Kufika
commenced your examination. 12 towards 1 o'clock.
Leso sikhathi ke ngaqala ngaso ke ukuthi ke ngimhloleke ngimbheke.
In that documentation, it reflects 12:56. Is it the correct?
12:52.
12:52. Beg your pardon. So, what was the time you concluded your examination?
I would say maybe it's roughly maybe 30 or 45 minutes later because I remember it extended to lunch. Then we went to lunch.
Ngizothi ke kwathatha ke isikhathi ngama 30 minutes kuya ku 40 minutes ngoba ngiyazi ukuthi ke kwase ngidlulela isikhathi sethu ke se lunch sase sithatha ke lunch.
Could it be 1:30?
I wouldn't be precisely sure.
No, could it be plus or minus, or approximately?
Approximately maybe.
Ngasho ke ukuthi labo kuma 1:30.
The last question is, let me just confirm if. Okay, sure. Thank you, sir. You said you graduated in 2019, if I heard you correctly.
Yebo ifundo zami ngayiphothula ngo-2019.
So you conducted a community service.
Yes.
You started from 2020.
Umsebenzi wami ke ukusebenzela emphakathini wona ngawuqala ngo-2020 lokho besithe yi-concept.
Prior to the examination of accused number 2, you had 6 months doing community service.
Yes.
Ngaphambi kokuthi ngisebenze ngaye ngisebenze noma ngihlangane naye ke umangalelo wesibili ke nganginesikhathi singange 6 months ngiwenza umsebenzi.
Were you working under supervision?
During my concept.
Yes.
Once immediately we work under supervision within the 3 years of our studies, but once you actually take oath, you are considered to be independent to work in a format whereby you work alone, but you have a superior supervisor that only in instances whereby there are complications that you also don't understand, you refer to them, complications.
Uma sesiqala nje kuminyaka yethu yokuqala ke emithathu masiqala yila usebenza khona ke ubhekiwe noma ke kukhona ke umuntu okubhekile ke noma lokhu kuthiwa ke i-supervisor ke kodwa ke uma usuqala ukuthatha isifungo noma usufunga ke yila ubonwa khona ke nanje komuntu oyimele kodwa ukhona ke ongaphezulu kwena ke uma kuukuthi kukhona ke okukudidayo bese kudlulisela kuloyo.
So you took an oath after 6 months?
No.
After you examined?
No,
Or before?
Take it before.
Sorry.
When you actually, there are two different oaths that you take. You take an oath before you even start seeing patients when you're still in school, and there's another oath that you're taking to show that you are suitable and you have graduated and you have passed all the standard that the degree requires, and you are able to be on your own and you can supervise the person. Meaning, or within a year, I can be able to even supervise a person who's like a year behind me.
Okwenzekayo ke lana ukuthi ke uma usufunga kufunga kabili ke khona la ufunga khona ke ngaphambilini uma kusesesikoleni ke ngaphambilini kokuthi ke ubheke ama patients bese kuthi emuva kwalokho ke yila ufunga khona ke ukuthi manje konke lokho izifundo lezi noma i-degree ekudingayo noma ekufunayo usundlulile kuona wakuphasa ke futhi ngiyakwazi ke ukuthi ke emuva konyaka nami ke sengingathi ke ngibheke ke noma ngisupervise ke omunye ongemuva kwami ngonyaka.
Have you encountered a situation where the police officers, you testify about prisoners that are brought to you or you said in 2020 in June, have you encountered a situation where the police will confront you with the request of conducting a dental?
Remember in our year of studies, we are in Medunsa. Medunsa is one of the biggest oral health centers in Pretoria. So we used to always, there was a module that whereby anyone is supposed to at least have treated people that are from public, whether it's from prison and whatsoever. So we used to get maybe in a regular base, you used to see maybe I would say 2 or 3 prisoners maybe in a month. So they used to always come, and when they come, the protocol is they come to you and then they explain what the patient is complaining about, and then you continue communicating with the patient regarding that. So yes, I have in more than one occasion.
Ngihlangene ke ngaphambilini ke namaphoyisa ke noma ngikhulumisana namaphoyisa uzokhumbula ukuthi besifunda khona eMedunsa ke enkulu khona ke ePretoria kuba khona ke imodule noma izifundo ke la khona ke kufanele uhlangane nabantu bangaphandle kulabo bantu ke bekuza futhi ke neziboshwa lezo ke bese ilethwa amaphoyisa likutshela iphoyisa ukuthi ke yini ke isiboshwa esikhala ngayo bese ke ukhulumisana nesiboshwa emuva kwalokho.
I put it to you now before I rest. I put it to you that on the day you conducted a general examination from accused number 2, you infringe upon his right to privacy, especially you breach the confidentiality of accused number 2 in relation to his medical status. What is the comment?
Now my question is, in which format, how did I do that? If this is, I'm saying if this is a form that's created by the state, which is the one that also everyone serves here, that we're supposed to question an individual who's coming to us and ask these questions, and we decide to ask them the way in which the form is decided, I'm basically saying it was me doing my job.
Uma uthi ke angizange kwenze kahle ke umsebenzi wami ke nokuthi futhi ke amalungelo akhe ke umsola ke noma umangalo lwesibili ke ngazange ke ngenze ngokwendlela ngokuphathelene nawo ke usho kanjani ke ngoba konke ngakwenza ngokwalendlela ke ekubhalwe ngayo kuyona le form imibuzo engibuza yona imibuzo ekhona la ngenza umsebenzi wami.
Last question. You were asked by my colleague as to when you're conducting that examination, you said accused number 2, Pongantanzi, looked worried. What do you mean by that?
Worried meaning, or the patient, the facial expression, the way in which they were, he looked kind of concerned. I wouldn't say maybe it's they are stressed or whatsoever, but they look confused. Worried meaning they look confused. They looked like, I don't know whether they don't understand the setting or what was happening, but that's a normal perception of any dental patient that's there. I tell you, any adult will tell you here that the moment they enter any dental practitioner's office, they start wondering what's gonna happen next.
Lana engangikusho ke ukuthi ke manje ngikhulume ngegama ke uWaret ngaphambilini ukuthi ke wayibukeka ke edidekile ke ungathi ke akazi ke ukuthi ke kwenzekani ke lana ungabuza noma umuphi ke kulaba abahlezi lana ke ukuthi ke noma umuphi ke umuntu omdala uma engena ke la ukuzothi kusetshenzwe khona noma ke akhishwe izinyo noma kwenzeke enike ila aqala khona ke ukuthi manje sengasazi ke ukuthi yini ezokwenzeka manje.
Say, on the form where it says complaint, main complaint, you see there? So it appears that it's written the patient requested. Can you read that for me, please?
It says the patient requested an examination for oral cavity.
What do you mean by that if you were approached by the police?
It means that I was informed what the patient is requiring to be done to them.
Lana ke engikufundayo ukuthi ke patient yase icela ke ukuthi ke kubhekwe noma kuhlolo ke la kuyena ke emlonyeni kusho ukuthi ke ilokho engakutshelwa ukuthi yini leyo muntu ayizele.
So that is hearsay. You were not directly informed by accused number 2. You were informed.
I'm going to go back to protocol. We, as medical professions, is every single time whenever a prisoner, it's not the same as a normal individual. We are supposed to be protected by the people that come with the prisoner. So our interaction before we even go to the patient, with the patient being there, the policeman or the warden must be able to explain to us what we're supposed to do towards the patient, because that's for our safety. That's one of the things that's supposed to have been done there. Because if the prisoner comes in, the policeman goes outside, and then I engage with the patient there, we're not really sure what I'm actually the patient is there for. So we need briefing from the person who's bringing them. It's as if to us it's as if it's a guardian. The patient who's bringing them, why are they the patient there in the first place? So that's why we're saying the main complaint is that.
Lana ke masikhuluma ngesiboshwa ke okuzothi ke ukhona ke umehluko phakathi ke nomuntu ke oyibuyela nje emphakathini ke noma oyibuyela ekhaya oyihambelayo ngoba lana ke kufanele siholwe yilo noma yila isiboshwa ayisihamba nabo beyibona ke abasichazelayo ukuthi uze ngani lo muntu lana ngaphambilini kokuthi singapho noma ukuthi iphoyisa liphume ubusushiya uyasala ke nesiboshwa sona kube uyisona esitshelayo uqala kulabo abahamba naye.
All right, there's one thing that I wanted to clarify before I step down. When accused number 2 was brought to you, was he brought to you by the members of the correctional services or by the police wearing civilian clothes?
There were my recollection of the people at that day. There were men that were in uniform, brown uniform, of which from ever since we've been seeing prisoners, we know they come with that. They come with the prison orders, which identifies that. And there was another one who was not dressed in a brown uniform. So maybe I assume that could be the police corps in that state.
Ma ke efika ke wayihamba ke nalabo kuzothi basebenza ke ejele babegqoke ke uniform ebrown bese kuba namunye ke noma abanye ke babangagqokile iuniform bona engayicabangelaka ukuthi ngaba amaphoyisa noma iphoyisa.
According to his version, those people were not from correctional services. They were Metro Police officers from SWAT. Just to put it clear that accused number 2 was not brought from prison, but from police station.
So, but not from my recollection, I remember someone dressed in brown. I don't know what what was really happening in that point of view, whether it's correctional service. That's what I'm saying. From my knowledge, people dressed in brown are people from correctional services.
Angazi ukuthi ke babebuya ke kuma Metro Police mina ke ngazi ngabona nje abantu ababegqoke ubrown ngoba ke mina ngokwazi kwami ke uma begqoke ubrown ilabo abasebenzela correctional service.
Thank you, my lord. I have no further questions.
Yes, Mr. Mnisi.
I've got one question, two questions now.
4.
Thank you, sir. Thank you, Dr. Hlokwe. When you were still a student at Medical University of South Africa, was Professor Mokokong still a Vice Chancellor and Rector there?
No.
Nkathi ke
At the time, there was a time whereby he had to resign. In the middle, at the beginning, yes, he was.
Yes.
In the middle, he had to resign. And then from there was De Beer, who came in.
No,
and
don't
became-
worry about his successors. I just wanted to know whether at the time at which you studied there, was he still a professor as you just said, no?
wayengasiyena ke uprofessor uMpoko nkathi ke noma
He
ke
was
uqale
for
wayo
the
uyena,
first, I
kodwa
think,
wabeka
first year.
phansi.
Oh, okay, in your fledgling stages of your studies. Thank you. Comprehensive medical assessment. You still remember that word?
Yes.
Where did it come from?
It means a full.
No, I don't want you to give me a description or a definition of that word.
Oh,
Where
it means
did
a
that come from?
comprehensive,
Yes.
a fully clouded, a fully well done examination of an individual, given what you have in hand.
Uma ke kube ubhekwa lokho ke onakho ke noma ubhekene nako phambi kwakho ke uma kuthethwa ke ngayo ke I comprehensive examination kusho ukuthi ke wenze konke noma wabheka konke.
Thank you, Doc. Listen carefully. I'm asking you, in the course of your testimony, where did that word come from? Comprehensive medical assessment. If you so remember. Let me assist you. When the state was just about to close leading you, his examination in chief, he asked you whether, in terms of what you did, there was a comprehensive medical assessment, and then you said yes. Do you remember?
That was not the question.
Yeah, I can tell you what the question was.
There's a reception where they do a preliminary assessment.
Community service, is it?
And he also does an examination.
Is that you're talking about, Mr. Mnisi? Community service.
No, my lord.
Okay, fine.
As I understood the state, I think that was the anti-penultimate question
Okay.
to the witness, where he says, would you then regard what you did, I'm just paraphrasing the
Okay, yeah,
state,
fine.
would you regard what you did as a comprehensive medical assessment? And the doctor said yes. Probably the record can clarify that.
That's not what the witness said. The state asked him, he said there's a station at reception where they do a preliminary examination, and then the patient then comes to him, and the state then asks him, in light of the fact that was this preliminary examination, and he also did an examination, so it was a comprehensive examination. That was the question he asked.
My lord, I don't want to be unfair with the witness here. Otherwise, I'll be deviating from the oath that I take, that as I embark on this profession, I'll be here to assist the court at all costs. I am not so sure whether the court will be amenable to allow us the opportunity to go to the record. I mean, to listen to the tape recordings, just to clarify this issue, or just to put this issue at rest. Because I don't want to be unfair to this witness.
Counsel put his question to the witness can comment.
My lord, the state is in no way authorized to tell me how to conduct my cross-examination. Now he's objecting that what I'm putting to this witness is not what he said to this witness, and I heard him well. Now I say, let's go to the record, or to the transcript, or to the audio recording. Then you say I should continue putting my questions. What kind of a process is that? What kind of a procedure is this? Because by the very fact that he's objected to what I've said, he's basically insinuating that what I've put to this witness is not what he said. And I maintain that that is exactly what he said. Now he says, let me continue with my question. And I'm saying to the court, out of respect for this witness, I don't want to proceed with a question that I'm putting to this witness that is disputed. Let us put this aspect of whether or not the state put to this witness that would you then therefore say that based on what you did, that was a comprehensive medical assessment. That is just to paraphrase him. That should be beyond doubt before I proceed with this question.
Let me tell you, from what I was asked, I don't remember,
Yes.
and I don't recall when it says comprehensive. Remember comprehensive, you're gonna listen to me. Remember comprehensive, it's an examination that was done on an individual.
Understand me, sir. Understand me. Understand me.
Sorry, Mr. Minister.
This word did not come from you. It came to the state, and then you concurred with the state that you did a comprehensive medical examination on the patient that you saw on that day. Now the state, as I'm repeating that question, then the state is saying, no, that is not what the state put to you. We are not part of the dispute. Let me assure you, we are not, you are not part of the list. The dispute, you see, the dispute is about me having understood the state
Sorry,
in a
Mr.
different
Minister,
way
let's-
than you paraphrased and answered the question. Yes, my lord.
Let's try and resolve this.
Yes.
Doctor, do you recall being asked the question as was relayed
What-
to you by...
What I recall,
Yeah,
I recall being asked
yeah.
if what, not from my mindset, if what I have said here or what I have written here, it's an honest and straightforward assessment of an individual. That's what I remember.
Ngikhumbulayo ke mina ngikubuzwa ke lana ukuthi ke uyiqiniso yini lokhu ukuthi ke i-assessment noma ke ukubheka ke noma ke ukuhlola ke umuntu engakwenza ngokukhumbula kwami. Ikona lokho engikhumbula ngibuzwa umbuzo.
May we go to the record, ma'am?
Yeah.
To the audio. As it is record.
Okay, can you trace the audio for us? When did
It was just what, I think it was his anti-penultimate question, last but two questions before he closed his cross-examination. I mean, his evidence in chief.
Persistence is more towards the end, my
Yes.
lord, where
Before the
I asked-
cross-examination,
yes, or free examination, where I asked the witness, in light of the fact that the patient first had his vital signs taken at the reception, and he also did the examination, so it was a comprehensive. I'm the one who used the word.
okay. Can you find that, sir? You have what? I can't hear. Oh, the volume is low. Is that the place?
But maybe it would be helpful if we go closer to the...
Yuna ke singabugcina ekufanele siqiniseke lokho ekuyikona.
What's the score, Mr. Mnisi? 2-0. I say the score is 2-0.
It's not 2-0, my lord. Actually 10 not.
3-0.
10.
And you win.
Yes.
Okay.
Thank
Did you hear the translation? I mean the recording.
I could hear that, my lord, and I know exactly what I said.
Okay, fine. Continue, Mr.
As it is. Now, that which you are referring to as a comprehensive medical report is what is contained in this medical form here.
That's
My lord, that is not correct. That is not what I put to the witness who spent the whole afternoon until the cows come home. Let me once again try to clarify this. The witness said before the patient comes to him, he goes to reception, they take the vitals.
Objection, my lord. Objection. He who testifies and needs to give answers to the question is the witness.
I'm raising objection, my lord. The witness mentioned that they also check for signs of trauma, and thereafter the patient then comes to him and he does his examination. So the question was, in light of the fact that the patient first goes to reception, they take the vital signs, they check for trauma, then the patient comes to him. It's an inclusive examination. That is what was put to the witness.
Okay, I will check this later. But Mr. Nisi, you can cross-examine this witness on the basis of what you say you heard.
As it is a court.
Okay.
So, that which you are referring back to my question, that which you are referring to as a comprehensive medical report is in essence what is contained in the form that you took this court through.
Let me answer you quite very correctly and clear before you go and twist things
Yes or
again.
no?
Listen, this is a comprehensive dental examination.
Good. This is a comprehensive dental.
It's even written on the top
I
that this
can
is
see.
a dental services, and it starts
Good.
there.
Don't-
Meaning that any dentist in any practice, in any government institution,
Yes.
they should have the standards of these things. These are the things that we are taught in
Yes.
order to go through for the patient.
Thank you.
And every line that everything I have said, I was going through all the lines that were here. I didn't drag something from somewhere and then bring it inside.
Thank you.
Lana uma ngikhuluma ke ngokuphelele noma ngokugcwele ngikhuluma ngakho lokho okuphathelene nohlolo noma ke ukubhekwa ke ngokwa semlonyeni noma amazinyo ngoba ke kubhaliwe nala.
You were telling me that it is even written here. This is just G. But I can see clearly. It is written in the Tlhabane Community Health Center Dental Services. Thank you. Now, on what basis do you then say that what you did on the patient, I don't know who the patient was, but the patient that you saw on that day constituted a comprehensive medical assessment and not a comprehensive dental assessment?
I'm going to continue. I think in this case, I'm saying it from my point of view. I was called in to talk about this. If you're going to talk about a comprehensive assessment, you guys should have went straight up to the healthcare center and got the whole file of the patient and then brought it here, and also with the medical examiners that were there and also the nurses that were there, because I'm part of a group. I'm alone. I can't say what the nurse did. I can't say what the doctor did. So in my turn, I'm telling the story that I saw, the story that I did on my own.
Thank you.
So meaning that me dragged into a corner of things that I'm not supposed to know it's something else.
Lana ngikhuluma ngokwenziwa yimina-ke noma lokho okuphathelene nowami umsebenzi. Uma kwakuwukuthi-ke kusekufunwa konke-ke manje ngabe kuhanjiwe kwayiwa khona-ke emtholampilo laphayana kwase kuthathwa ifayile leyana-ke kwalethwa futhi nalabo abasebenza khona lapho kuleyo ngxenye leyo-ke yasemtholampilo nabo-ke balethwe la ngingafakwa-ke ekhoneni lezinto mina-ke engingazazi ngoba-ke ngiyingxenye yeqembu.
No, nobody is trying to lead you into a snare. You're not being cornered here. It's just what you told the court. I am asking questions based on what you told the court. It is therefore an error to have told the court that what you did to the patient that you saw on that day, who is the subject of this hearing, and the reason why you're here today, it is therefore an error to have told the court that what it did on him was a comprehensive medical assessment. Because, as you say, you don't know what the others did. That's all.
In my response,
Yes, respond.
I did say everything that I've said. What I'm trying to actually point out is
Yes.
it's on this document.
Yes.
Therefore, that means that I was just basically doing my job. That's what I was supposed to have done. And according to my scope,
Yes.
from where I know,
Yes.
comprehensive medical examination involving a patient as a dentist, it entitles this. That's what my job. I can't go and do what a doctor does if I'm not a doctor. These are the things that are supposed to. The file is saying everything. So I don't get where we are leading to.
Ukuthi-ke uhole laphi uyakuphi nendawo angazi-ke kodwa mina engikhuluma ngakho yiloko ebhalwe lana-ke ekuyikona-ke ukuthi-ke yikona okuphelele okugcwele engakwenza mayelana nalo msebenzi mina engiwenzayo. Angikwazi-ke ukuthi ngikhulume noma ngisho okwenziwa udokotela mina engasiyena.
Doc, I'm going to implore you and plead with you to be very patient and be calm. And don't rush, because in South Africa there's no rush. The rush is in Russia where they rush. But what I'm putting it to you is that it is therefore a misnomer, an error to have told this court that what you did on the patient on that day was a comprehensive medical examination in instances where you only dealt with these patients on the question of the teeth. Not so.
Mr. Court, please note the witness has repeatedly answered the question. Is there any point in repeating the same question, counsel?
Thank you, Madam. Let us proceed, sir. Now, what is contained in this form suggests that what you did can be referred to a comprehensive medical assessment. Now, you have said, and I'm not saying this is a comprehensive medical assessment, it's just a hypothetical situation. Now, you have said that when the patient arrived, actually your duties as a dentist, you start to treat the patient from his waist.
Assess. I said assess, not treat. I can't treat a
You
patient.
assess. Yes.
Then let's get it right.
Assess. Yes. Assess. Just come down.
And the dictionary says assess is what you see, not examine. Those are two different types of examinations.
Yes.
They are listed. There is inspection, assess. Assess is what you see.
Thank you for the lecture, sir. I think for the whole day you have given a lecture, but thank you. You said as a dentist, you assess a patient from the waist upwards. That's all. Thank you. Now, you told the court, as per this form, that you checked his general appraisal. What did you say again? What is a general appraisal?
That's the way the assessment comes in. So that's where I
What
believe
did you say is
I
general
believe-
appraisal?
general appraisal is
Yes.
the general look of a patient.
Thank you.
Ebengikusho ke la ukuthi ke uma umbheka ke ubuke nje ubone indlela abukeka ngayo.
You went on to tell the court that you also looked at his TW joints, his lymph nodes, his lips and buccal mucosa, his oropharynx and tonsils, floor of the mouth, the tongue, the gingival and periodontium, angle classification, teeth chart, and ultimately you did a teeth chart. That's all. Thank you. Now, the state says to you, did the patient tell you that he was assaulted? And what was your answer?
The patient never stated any assault. The only image that I was given, it was from the policeman that came in that we are looking for whether the patient had a gold tooth or not. I was assessing for that, and therefore meaning when you assess for that, you need to state every question that's here. You need to state what it means and what it might indicate and what are the things when you say it's abnormal and it's normal. So I can't
Doctor.
state it's normal and it's abnormal
Doctor.
without stating
Doctor,
what it is.
Doctor, can you please understand the question? The question that I'm posing is the state, in other words, my colleague, the prosecutor, says to you, ask you whether the patient told you whether he was assaulted. I'm asking you, what was your answer to his question?
My answer was simple. From me, from my assessment, I didn't see any sign that the patient was assaulted.
Aibo.
Ubuziwe ke ngumshushisi lana ukuthi akutshela yini ke ukuthi noma washo yini kuwe ukuthi washaywa yini. Yabe isithini ke impendulo yakho? Mina ke uma ngibuka ngimbheka ngabona ke ukuthi kwakungekho okushona noma okuyinkomba ukuthi ke washaywa.
Is that what your answer was when the state asked you that question?
As a copy, is this a memory test? You know, the witness gives evidence in chief. If there's a question that my learned friend needs to ask, can he just maybe ask the witness? How is the witness now supposed to play his mind back, remember each and every question that he was asked and what his answer was? We submit, Mama, that is not fair.
Yes, Mr. Mnisi.
There is nothing unfair with the question, Manos. I think just my colleague feels a little bit reckless. Let me remind you, when my colleague, and I'm well within my rights to ask you to repeat the question that my colleague asked you, but this is what you told the court.
Can I say?
Listen, say, listen.
I-
This is not a circus. Listen. I am still speaking. This is not a circus.
Okay.
Yes. When my colleague said to you or asked you this question, whether or not the patient that you saw on that day told you that he was ever assaulted, your answer was, no, he never told me. Is that not what you said?
Isn't it saying from my inspection and from what I was told? Isn't the same thing? Isn't assessment and also the questions
that not what you said?
Is there an okay, let me ask you, is there anything in here from this document that says I should ask a patient if they were assaulted?
You know, I seem to doubt your level of understanding what I'm saying, and basically it will go down to the level of you understanding me as a doctor. You know, I thought at some stage me and you being a doctor would be plus minus be on the same level of understanding each other. But the way in which your trajectory is proceeding, I seem to have a very serious problem. A very serious problem, you see. Thank you. What you told this court as a response to the question that my colleague asked you on whether or not the accused that the patient that you saw on that day told you that he was assaulted, you specifically said, no, he never told me that he was assaulted. That is the answer that is on record. I am therefore basing the following question on that answer.
Okay.
Did you expect him? I'm not finished. I'm not finished. I'm not finished. I'm just pausing. Did you expect him to give you that answer when you did not ask him that question?
No.
No.
Lana ke umbuzo uthi ke ubuziwe ngumshushisi ukuthi wambuza yini noma ke wakutshela yini ukuthi lona ke washaywa ke wabe usuthi wena ke cha ingabe ke manje umbuzo olandelayo uthi uma kuukuthi wena ke awukazi umbuzo loyo mbuzo loyo wawulindele ukuthi akutshele yini cha.
Thank you. Did it ever occur in your mind that you should ever ask him whether he was assaulted?
I'm not supposed to ask if a patient is assaulted or not. That's a medical officer's way of doing. I'm supposed to be able to identify if there are any signs and then report them. Those are quite very different things.
Mina ke okwami asikuthi ke kufanele mina ngimbuze ukuthi washaywa yini ke ukhona ke udokotela osebenza ngalokho ongakwenza lokho okwami ukuthi ngibheke nje ukuthi ikhona yini impawu ezikhona ke noma inkomba yini ezikhona ubese uma ukuthi ngiyathola bese ngiyareporta ke lokho.
Thank you. Now, in terms of your assessment, examination of the patient, on the basis of what you've just said now, you assessed him and found that you could not find a possible sign that suggests that he was assaulted, not so?
Exactly my point.
Ngishilo ukuthi akukho engakubona okwakungasho ukuthi washaywa.
Thank you. In your examination of the patient, on the notion that this was a comprehensive medical examination, did you check his eyes? Yes or no?
I go back to the file.
Yes.
I was saying everything that was on the file.
Yes.
Ngibuyela futhi ukuthi ngawabheka amehlo akhe ngibuyela futhi ke kufile lena ngangisho konke okukhona noma ke okubhaliwe khona la.
Did you check his did you check his ears?
I go back to the file.
Yes.
Wayibheka yini indlebe zakhe ngibuyela futhi ke kuyona ifile.
Did you check his nostrils?
That's a general. I did say I explained right now, or one of the signs that's there, that when you assess, you check the mouth area and also you check the nose, or whether there is any deformity. I'm not eligible to open the patient's nose and check whether there is something inside it whatsoever. I'm checking the general appraisal. I didn't speak of that.
Thank you.
Okwami ke bese ngishilo ngaphambilini ukuthi ke ngiyabheka ke umlomo, ngiyabheka ke ikhala, ayi ukuthi ke ngibheka ngaphakathi ukuthi kunani ngaphakathi, kodwa ukubheka nje ukuthi kuloko engikubonayo ngibonani.
Would you dispute it if I were to say to you, had you gone an extra mile, and I know that was not your area of operation, but had you gone an extra mile to check his eyes, or maybe to examine his eyes, if I may put it like that, and probably to examine his ears, there could have been possible signs that would have led you to conclude that something had happened to this gentleman. Would you dispute that?
Examination of the eyes is done by an optometrist.
That I understand.
For the ear, it's
That I
done by
know.
an audiologist.
Thank you.
So if I'm going the extra mile, I will be doing what's not within my scope.
Thank you. That I understand.
Ukhona udokotela wamehlo, ukhona udokotela wendlebe, uma ke mina ngandlulela kulokho ke ngizoba ngenza
So as a-
engafanele ukuthi ngikwenze.
So as a result, I cannot say I would have been able to confirm
Yes.
or deny those things, because that's not my job.
Angeke ngisho-ke ukuthi-ke ngangizobona-ke ukuthi ngempela khona okwenzekayo ngoba akusiwona umsebenzi wami.
It's the same as asking a carpenter to check whether a car has an oil leak or not.
Oh, you're a carpenter.
I know, I'm asking.
Oh, okay.
It's the same as that.
Oh, okay.
Kufana nje ukuthi-ke uthi-ke ucarpenter ayibheke ukuthi imoto ingabe ivuza uwoyela yini.
Okay, thank you, sir. Thank you. With the carpenter example. Do you then realize that the fact that you told this court that on your examination, you could not detect whether or not the patient that you see on that day was assaulted. That conclusion is based on a very light and a what do they call it now?
A cursory.
A cursory, yes. A cursory examination of what you did on that day.
I was here.
Do you understand the term cursory? Means very light. It's
Yeah.
Wonderful.
Listen,
Yeah.
I was not here
Yeah.
to actually confirm
Yes.
or make sure whether the patient was traumatized or whatsoever. I was here to
Yes.
read the thing that I filled up, the document that I had in my position.
Thank you,
That's
sir.
what I was here for.
Thank you, sir.
Engikuzeleke lana mina-ke bekuwukuthi nje ngizofunda-ke noma ngisho lokho engakwenza lokho kwenzeka ngaleliya langa.
So basically, that is the information that now you're directing to the state, that you were not called upon here to come and state whether or not that the patient that you saw on that day was assaulted. Is that a message that you now?
Message I'm delivering
Forwarding to the
is
state.
yes, as I took oath,
Thank you.
whenever I'm required
Yeah.
to come and explain what I have done, I'm supposed to come in front of the court or anywhere where I'm required to say what I have done. That's what I'm actually referring to. So that I'm not here to confirm whether the patient has gone through any trauma. I'm supposed to say from what I've seen,
Yes.
my examination, what does it say
Yeah.
to everyone who sees the page? Does it say the patient was traumatized
Yes.
or the patient had any sort of lesions or the patient has any sort of disease?
Yes.
That's basically what I'm here for.
Thank you.
Engikuzeleke lapha mina-ke ukuthi nje lokho engakubona engangibuka kuyena ngase ngakubona mina-ke nokuthi-ke ngizosho kona-ke la.
So you're basically saying you can't tell whether the patient was assaulted or not. The patient that you saw on that day.
You can, at certain instances, at certain severities, whereby it's there through what we are taught to assess, and certain conditions. The file, as it was saying, when you go through the clinical examinations, this is the parts of the things that we're saying, or to a general dentist, if a patient was assaulted, to a certain extent, you can be able to, I did mention that if a patient, yes, they were actually assaulted, they were bruised, they had a blue eye, or maybe they were busy choked, or there was any sort of trauma that happened to them, due to the form, the way in which it is, I could be able to detect or there are bruises where and where, due to the form that I have. Meaning, or yes, a person can go an extra mile, because this is what we call in medical term, there is internal damage for an individual, meaning or a patient can appear to you right now saying or they have a head that's bleeding inside a teared vessel, but you can't even tell it because when you can't see it, but there's someone specific who's supposed to go an extra mile and check that. So I was not supposed to go an extra mile. I was supposed to do what's on the file. I did that. I said that. That was my job.
My question.
Mina-ke okwami kwangasukuthi-ke ngeqa-ke ngidlulisele-ke kulokho esifanele ngikwenze, kodwa-ke lokhu okukhona-ke okubhaliwe khona lana-ke uma kuwukuthi umuntu uyakutshela-ke ukuthi-ke lana mina-ke ngilimele ekhanda kodwa-ke yakubonakala ngilimele ngaphakathi, ukhona umuntu owenzayo loyo msebenzi loyo.
So because you are not that person, you therefore can't say, you can't really dispute as a matter of a fact that the patient that you saw on that day, prior to you seeing him, he has been pommeled into a morals of bitterness, he was assaulted. You can't dispute that.
maybe you didn't actually really understand maybe what I had narrated to you. Let me rebrief you again. Understand here. There is a certain extent whereby you can be able to identify such things, but there are some extent that you can't. That's why whenever a patient comes and complains of clinical signs of being, even to a general doctor, they might send them to an RMS scan, send them to an X-ray to do further investigation that they couldn't see with the naked eye. So now from what I've seen, I was told that I'm looking for whether there's a chip tooth that gold came out from, and then I assessed that in general, and then I also checked everything that's there from what I know, from what's within this file. It says, from what this file says in conclusion, it says, from my knowledge due to the file that was created by the state, which is allowed to be practiced in Northwest in that tribunal district, I didn't see any signs from what I have seen. That's what I can be able to say. Saying, or I can say, if I had gone an extra mile, saying, or if I had, I can conclude and I can say, I'm saying, yes, I can conclude to a certain extent, not further and beyond. Certain things will have needed to be further examined further on. But to my extent, that's what I could see. So that means from what I could see, that's what's there on the file.
Mina ke ngiyabheka ngibuka ke ngisebenza ngaloko engikubonayo ukuthi zikhona ke izimo la khona ke ungathi ungabona ke ezinye ke ungaboni ke umuntu kufanele andluliselwe ke noma umunye udokotela ngeke akubone lokho ngeso lenyama kodwa kuzofanele umuntu adluliselwe ke kuma scan. Mina ke ngenza lokho ke ngokwale form eyakhushwa uhulumeni wakhona ke eNorthwest ngasebenza ngokwendlela iform engiholela ngayo ukuthi ngenze ngakhona.
Sir, did you understand my question?
You also didn't understand my answer, maybe. Your question was, can I conclusively? Can I conclusively?
Sir,
Mr. Mnisi, now we are
did you understand my question?
No, just wait. We are now involved in a debate with the witness. Just put to the witness what your instructions are.
Thank you.
Or what you logically think.
Thank you, madam.
He can't conclude having done what he calls a comprehensive assessment.
Thank you, madam.
Otherwise, we'll be here
Yes.
until.
Thank you, madam. Let me spare you the agony, sir. I am putting to you that with the little assessment that you did on the patient on the 22nd of June 2020, you are in no way, you were not actually positioned to come and tell this court emphatically, or as a matter of fact, that the patient that you saw on that day, prior to him coming to you, he was assaulted. Do you have any comment?
No, I don't have any comment.
Thank you.
Mina ke ngithi kuwena ke ngohlelo ke owalenza ke noma ngendlela ke owamxoxa ngayo ke awukho isimo ke sokuthi ungaza ke kulenkantolo uzoyitshela ke ngempela ke ukuthi cha akazange ke ashaywe ukuthi cha akukho engakusho.
Thank you, sir. Sir, let me spare you the agony. That would have been my last question to you. Thank you.
Yes, Mr. Amalo.
Thank you, my lord. I have no questions to
Mr.
you. Yes.
Shalom.
My lord, I see it's 25 past now.
Now we're going to finish with this witness today. We must sit until 9 o'clock. So be it, please.
Thank you. Sir, doctor. The document that is in front of you, if you can assist me, what do we call it? The one that we have been testifying about.
It's a comprehensive dental exam. Dental exam. That any dentist must be able to do. This is what a comprehensive dental exam is.
Lana ke kusho ukuthi ke noma ufike udokotela ke osebenza ke ngamazinyo ke lona ke ukuhlola ke okuphelele okugcwele kwawo amazinyo.
Okay. Is it a report or it's the recording? What is it?
It's a file whereby you assess, and then from what you have assessed, you write down and then you report. It's even stated here, it says progress report, notes, and treatment that's supposed to be done through the patient.
Ubhaliwe ke nalana ke ukuthi i-report ke noma umbiko ke mayelana nayo ke i-patient.
In other words, you are saying this is a report. Am I correct?
I'm saying it's a dental exam. A dental exam includes findings and report and treatment of what the things that you have seen.
Okay.
It's an examination form.
Ifomu ke lena lana khona ke i-patient ke lana ihlole khona ke ifaka phakathi ke kunombiko nokuthi futhi ke yini ke oyenzile ke kuyona ke i-patient leyo.
Okay. So, according to you, this form, in this form, you will record every examination that you conducted to that particular patient. In this case, we're talking about accused number 2.
This is the guideline that we use, yes, from the standard guideline that we use to record everything that I have seen from the patient or I have noticed abnormal or normal stuff. That's there.
Lana ke ikona ke okungiholayo ke ukuthi yini engiyibonile ke kuyona ke i-patient okungendlela noma lokho ekuyekho ngendlela noma ngesimo esifanelekile.
You testified in your examination in chief that you examined the upper part of the body of the accused.
I not examine, I said the same thing to him, inspect.
Yeah. Whichever, you can
Such.
give us another terminology, but that's what
Those,
you did.
those are two different. Examining means palpating, checking bloods, doing other things. That's a full inspecting. It's what you see. It's what you just have seen.
Okay.
Lana mina ke engakwenza ukuthi nje ngiya ngalokho engikubonile noma engakubona hayi ukuthi ngase ngena ke ngenza umsebenzi ke ngibheke igazi nokunye.
Is it recorded here in your report? Maybe I missed it. Is it recorded in this document that you inspected the patient who was in front of you and this is what you discovered? Is it recorded in this document?
On extraoral examination, it says general appraisal, which involves what you have seen in general. If it's abnormal, I would have ticked abnormal, I ticked normal. Meaning that I check the general appraisal of the patient, the way in which the patient is standing, the way in which the patient looks, and the way in which the patient might appear to have any sort of normal abnormalities from the normal individual human being.
Lana ke kubhaliwe ke ukuthi ke nanjengoba yila engithika khona ke ukuthi normal noma ke abnormal yiloko engikubonayo mina uma ngimbhekile ke bese ngiyathika ke.
Okay. From your observation on the upper body of the accused, you did not ask him to take out his clothes.
I
Is that
stated
correct?
in the recording, as he likes referring, that it's not my job to ask a patient to take off their clothes, and then also,
I'm taking a very serious objection, but actually I'm getting a little bit. I don't want to lose my patience, but the gentleman there, he's a doctor. I respect him. He does not have to sound sarcastic when he's answering the question. You don't have to point at me and say, I kept on referring to him, I kept on referring to him. To him, I am not him. Actually, to him, I am myself. I am an advocate of this honorable court. I am going to request the court to respectfully request this witness to answer the question directly and to avoid to sarcastically keep on referring to me. I'm taking
Yes.
a very great offense.
Mr. Flora, can you continue, please?
Thank you. Furthermore, in your testimony, you were asked about the injuries, if the accused had injuries on his face. You remember that part of the...
yes, I do.
Yes. And you said there were no injuries. on his face that you noted or you observed?
That I observed.
Yes.
ngishilo ukuthi kwangekho ukulimala kuyena ke ebusweni engakubona mina.
Okay. How many patients did you examine on this particular day? Or did you see on this particular day?
We were working, 3 of us that day. We have 2 operating areas. We alternate. There will be the first person, 2 people that come
How
in.
many? How many patients?
How many patients?
Did you see?
I can't really recall how many patients I could.
Okay, it's fine.
Ngisakhumbula ukuthi mangaka ama patients engawabona ngaleli langa.
And you did not record in this document that you observed the face of accused number 2 and there were no injuries. Am I
Because
correct?
there is no question in the file that says I should have recorded that. I was recording what I've seen. As he was, sorry for saying that, as it's already been said, that when you look at everything that I've gone through here, is the things that I was supposed to have been done. So meaning already, the general appraiser, if I did notice that there's something, even a significant trauma to the face and whatsoever, I'll probably take up normal and right, or there is a bit of a scar on the left and there is whatsoever. As if I've already indicated when it comes to the other parts of gingival, I have noted already, okay, it's abnormal, then there's supposed to be this.
Okay, doctor, don't be long, doctor. You are a doctor by profession, am I correct?
Yes.
The witness is trying to explain now. Counsel is raising her voice and interrupting the witness. We submit that that's pressuring the witness. The witness should be allowed to respond to a question.
Yes.
Thank you, my lord. I'm on the injuries. I'm on the evidence, part of the evidence when you said you did not see, you did not record any injuries. And I've asked you how many patients you treated on that particular day. You said you cannot recall. Okay? Then my next question is, how do you recall that the accused did not have any injuries on the face if you cannot be able to recall the number of the patients you treated on that day?
And I'm going to go back, and then I'm going to say this. That side, we barely see any sight of anyone in handcuffs or any sort of prisoner that was there. So on that day, specifically on that day, he was the only prisoner I've ever seen. Meaning that whatever was really happening there, anyone who has experienced one moment in a very long time of something that they never seen before, you can basically do recall. He was not a normal patient.
Okay.
That was the thing.
Can you allow interpretation, doctor?
Wazi kanjani ke uma kuwukuthi awusakhumbuli noma ukuthi bangaki ke ama patient owabona lapha ukuthi yena ke wayengalimele ebusweni. Yena ke isona kuphela isiboshwa engasibona ngaleli langa futhi ke kule ndawo esebenzela kuyona nje akusiyona ke into evamile noma ejwayelekile ukuthi nje sihlanganeke noma kuze iziboshwa ukuthi nake manje ke leso sigamo ke sodwa esenzeka ke isona ke esingabangela nje sona nje sisodwa ukuthi ke ukhumbule.
You know, doctor, with due respect, the fact that you did not record that in this document, that you inspected or you observed, whatever the way you did, but you found that there were no injuries from the accused face, that finding or whatever, you should have recorded it here. In the absence of that finding, which is recorded here, it means that we are fabricating the story today. You never observed the accused on that particular day, his face.
The witness has already answered that. We submit that there's no need to repeat the question.
Yes.
Thank you, Madam. It's on record, my lord. Thank you. And secondly, Dr. Whilst I'm still on in the observation of the injuries, are you a district surgeon? District surgeon, or do you work as a district surgeon as well?
We submit that question is improper. The witness has said he's a dentist. That's his area of expertise.
My lord, I know the witness said is a dentist, but I know where I'm going to, my lord, because I'm cross-examining on the on the observations is in respect of injuries when he is a dentist, my lord.
Yeah, but you just have to put it that because you're a dentist and you're not a general practitioner, you are not able to comment, like Mr. Mnisi was saying. Otherwise,
Yes.
you know what?
Can I rephrase?
Wait. One time, after this trial is long over, when we all have gained experience, you must listen to how this cross-examination is conducted. You must listen to the answers. You'll realize that maybe you should have posed these questions in another way. Here you can see, you're just debating with this gentleman. He says this is what he didn't observe. If you put it to him that he's incorrect because he doesn't have the qualification like Mr. Mnisi has done, that takes care of the thing, and then you can come and argue. But now you are denigrating each other. You're not a district surgeon. You are not this, you are not that. It doesn't help me to solve this case, because I'm going to solve this case on the basis of whether the state has proved beyond a reasonable doubt that the confessions were made voluntarily or freely, or I'm going to find that maybe the opposite, based on the evidence. But this to and froing about this document, I don't think it helps this court, because the gravamen of the criticism which Mr. Mnisi puts to this witness is basically saying the court should not accept the observations proffered by this witness. Beyond that, whether he served 6 months comprehensive training, how many patients has he seen, it's a difference between an assessment and an examination. It's a debating school. That's what we are under. Because the law is clear. If there's an allegation which has been put by the state, bring evidence and rebut it. Or when you cross-examine this witness, you can put it to him that he's fabricating, as you say, because he doesn't have the expertise to have made that assessment. And then you go forward. Okay.
Thank you, my lord. Can I proceed?
Yes.
Thank you. Thank you, my lord. Sir, do you know a form that is called a J88? It's a medical report, J88.
Yes,
Do you know it?
yes. Ngiyazi ke iform lena ke esetshenziswa ngayo ke ngodokotela abayibiza ngokuthi ke i-J88.
Do you know that that is the form that is used by a district surgeon when he is conducting examination to a person?
I do. Ngiyazi ke nokuthi futhi iform ke esetshenziswa uyena ke udokotela uma ke esebenza ngomuntu.
And in that form, the doctor will record the injuries or the condition of the person that he examined on that particular day. Am I correct?
I do.
Yes.
Ngiyazi ke noma futhi ukuthi ke ubhalani ke kena ke udokotela.
And in this is not a prescribed form that is used to record the injuries observed by the doctor when he's examining a patient. Do you agree with me?
I agree.
Thank you.
Ngiyavuma ke uma usithi akusiyona ke iform lena ke ekuyiyona ke efanele ukuthi yasetshenziswa ke uma kuwukuthi udokotela ke ubheka umuntu noma uhlola umuntu.
And also, let's go to the page number 4, wherein there is a consent form. Consent part at the bottom there. You see that form, that part? Were you present when this document was, this portion was completed?
The handwriting on the date, it was mine. So yes, I was present in the patient side.
Okay.
Ngathi ke i-patient sign lapha yebo ngangikhona ngoba ke la ekubhale khona i-date mina owabhalayo i-date.
When the signature affixed there was appended, were you present?
Yes, I was.
Ngangikhona uma esigned.
Who signed there?
The patient signed for this,
I-patient
as far
ke
as I'm concerned.
ukwazi kwami ke iyona eyasign lapha yana.
On the first page? where it says patient signatures information. Who signed that?
Also is the patient.
Nala page yokuqala ke nalapho yena wasayina.
Were you present?
Yes, I was.
Yebo,
That's my
ngangikhona.
handwriting on the date.
Kangikhona nalapha khona i-date mina wayibhala.
Did you explain specifically to the accused what is it that he was signing here?
Fully, we're supposed to do that. That's part of the job.
Ngokuphelele futhi ngamchazela ke ukuthi uma esayini usayindelani ngoba yingxenye yomsebenzi leyo.
In what language did you explain?
I used English.
Ngangisebenzisa ke i-English noma ke ulimi engangilisebenzisa kwakuyi-English.
Did you ask the accused if he understood English?
At the beginning, when we were busy assessing the patient, I asked, there was, as I already stated when I was speaking here, that there was an assistant, because my Zulu is not proper, that was helping with the Zulu. I used to ask the questions in English, and then there was an interpreter of an assistant that explained these things to the patient.
Ngabe wambuza yini umangalela ukuthi ke isingisi uyasizwa yini? Bengishilo ke ngaphambilini uma ngikhuluma lana ukuthi ke isiZulu sami ke asikho kahle, kodwa ke lona engangisebenza naye engilekelela ke uyena ke owayengisiza ke ngokuthi ke ahumusheke ngesiZulu.
But when this consent part was completed, the interpreter was no longer there. You yourself who
No,
interpreted.
they were there. It's an assistant. The assistant remained there throughout. They don't leave. I leave before them. They have to supposed to give patients instructions of what they feel is something that's supposed to do and whatsoever, and also dismissing the patient. Then I
Thank you,
move
my
to
lord.
the
I've
next.
got no further
Okusho ukuthi ke nkathi ke le ngxenye ke yona ke ihunishal noma ke isayindwa ke wayesephumileke lo wayetoleka cha abahambi baba lapha yana isikhathi sonke imina engihamba kuqala kunabo ngoba bona bafanele bachazeleke ama patient okunye okufanele bakwazi.
Any re-examination?
None, thank you, my lord.
Okay. Thanks, doctor, for your assistance. There's one thing I want to put a joke to you. When they ask you a question, you said you're checking and assessing the patient as he's with you when you're filling the form. For my myth, and then you were asked, you said a man can't get pregnant. You remember saying that?
Yes.
Hello?
Yes.
It just caught my ears because I've heard women say, I've got a body trapped in a man's body. Have you heard that? One day you'll appreciate the joke. Okay, can you address what's happening on Monday?
As a court, please, my lord, I thought we can wrap things up today from the state point of view, my lord. Just a few aspects.
Oh, so you must go to Monday still.
Well, as I indicated, my lord, I've got another party head. I'm not here for the whole of next week, my lord.
So you wanted to wrap something
Yes.
now?
Yes.
Now?
Yes.
Okay, let's hear you.
My lord, just three things. Firstly, yesterday there was an issue of the visitors book,
Yes.
visitors register at Pretoria Moot. The feedback that I've received is that this was just an informal register. They can't trace it. However, they're still looking. So at this point, my lord, they cannot trace it.
Okay.
Then, secondly, there's the issue of the transcripts from Boksburg Magistrate Court.
Yeah.
We just want to hand up the transcripts. We've marked them Exhibit EE. The charge sheet from Boksburg Magistrate Court is Exhibit E. So the
Exhibit EE.
yes, EE.
Yeah.
So the transcript of the 27th of October 2020 from Boksburg Magistrate Court is marked Exhibit EE in brackets 1. Then the transcript of the proceedings of the 27th of November 2020 from Boksburg Magistrate Court is marked Exhibit EE in brackets 2.
Okay.
Then the proceedings of the 5th of March 2021 from Boksburg Magistrate Court is marked Exhibit EE in brackets 3.
Okay.
Yes. We have accordingly updated the list of exhibits
Yes, sir.
wherein we are incorporating
The three documents.
the transcripts. Yes. And then, lastly, my lord, there is a letter which we have marked exhibit YY in bracket 1. This is a letter, my lord, from the Legal Practice Council in Gauteng. I've given this letter to my colleagues.
Your colleagues have it.
Yes, last year already.
Okay.
Yes. We submit that that letter. It's admissible. It's relevant. If we need to argue this point, we'll do so, my lord, at a later stage.
Okay.
But we beg that it be received as exhibit YY in brackets 1.
Okay.
I'll place the contents on record. It's dated the 31st of October 2023, and it's written by a senior legal officer, professional affairs from the Legal Practice Council, and it reads as follows. I hereby confirm that according to the records held by the Legal Practice Council, Advocate Dominic Ntokozo Mjiako was admitted as an attorney by the North Gauteng Provincial Division of the High Court of South Africa on 26 March 2012 and was granted permission by the Legal Practice Council on 6 July 2021 to convert his enrollment as an attorney to that of an advocate practicing without a trust account. Advocate Dominic Ntokozo Mjiako is recorded as an advocate practicing without a trust account, and his legal practitioner number is recorded as 31584.
Okay.
Le ncwadi ke efundwa la umshushisi ke incwadi ephuma ke kwisigungu ke esiphethe ke abameli idate yakhona i-31 October 2023 futhi ke ibhaliwe ke uthi ke ngiyaqinisekisa ke ukuthi ke Advocate Dominic Ntokozo Mjiako ngempela ke ukuhla ke babameli abavunywa ke inkantolo noma ke iNorth Gauteng Provincial High Court nge-26 March ngonyaka ka-2012 wasenikezwa futhi ke imvume iyona ke i-LPC nge-6 zikaJuly 2021 ukuthi ke angabisaba ke umeli noma ke i-lawyer, kodwa ke manje abese ekhushulelwa ke ekuthini abe i-advocate. Futhi ke u-Advocate Dominic Ntokozo Mjiako futhi ke ukhona ke kuhla lama advocate futhi ke upractice noma ke usebenza ngaphandle ke kwayo i-trust account kanye ke futhi nenumber yakhe yokuthi abe umeli ibhaliwe khona lapha yana yabhalwa ke lo oyi-senior legal officer.
Okay. Thanks. Mr. Gomezulu and the other councils, are you going to dispute the information in this letter by the LPC?
My Lord, there is no dispute in relation to, it has been put it clear that the defense does not dispute the status of
Okay, fine, no problem.
Mr. Mjiako.
Okay.
Yes. It's
Mr.
only concerned about the relationship between accused number 2 and Mr. Mjiako.
No, you're now going to other things.
Yes.
Me, I'm just asking this letter, are you disputing the veracity of what is stated there? That's all. Mr. Minister?
I plead no contest. In other words, I don't dispute this.
Okay.
Not contested, thank you.
Yes, Mr.
No, my
Ron?
lord.
Okay.
Then, lastly, my lords, we've handed various occurrence books and registers from various police stations, exhibit MM, NN, NN1, NN2, PP, QQ, SS, UU, 1 and 2. The originals are here, they are available, my lord. court orderly has just gone to collect them.
Okay.
If it's, we can keep them in our custody and bring them to court every time.
Yeah, you should do that.
Yeah, should they be needed.
Yeah, please.
futhi ke ney'ncwadi ke ezahlukeneke zama-police station ahlukene zikhona-ke lana zizogcinwa-ke umbuso uma ukuthi ziyadingeka-ke zizolethwa khona enkantolo.
Then the state closes its case Maloto and the trial is in a trial.
Okay. Umbuso uthi-ke lona ufakazi oqeda ukuphuma lana-ke bekuwufakazi wabo wokugcina-ke kulolu daba-ke oluvelile-ke kulona icala leli.
Okay, so we sit on Monday when the defense will decide what to do. Mr. Ngomezi.
As a court, this is Maloto. Mr. Mjago. My colleague will stand in for me for.
Oh, yes, Mr. Banda. Okay, thanks. Mr. General.
Welcome, Jiab, welcome, Jiab. Welcome, Jiab. Welcome, you, Jiab.